We study food. Because that is the people's health. We study drugs. Because that is the people's safety. We study cosmetics. Because that is the people's happiness. In order to ensure that your daily life is safe and happy, our love for you is realized through innovative science. Science of love for our people, the Ministry of Food and Drug Safety. The bigger our love, the stricter we become. As an agency that faithfully performs its duties given by the people, everything that our people use, from food and drugs to quasi-drugs and medical devices, to health-functional food, cosmetics, and sanitary products, reflects our thoroughness. In order to keep our food table safe from adulterated foods, germs and viruses, and hazardous chemical substances, we manage the safety of food ingredients according to systematic standards, conduct on-site inspections of manufacturers, and thoroughly manage the customs process for imported food to block harmful elements in the first place. Through the hazardous food sales prevention system, we also respond immediately to safety accidents after distribution. As the country's food and drug safety control tower, we make South Korea a nation that puts people's safety first. The more we care, the more we listen. As we are well aware that our efforts have no meaning without the people's trust, we transparently disclose the safety management information of food and drugs to the public. We also make efforts to improve school meals for our children, take the lead in educating people on proper eating habits, and establish a social safety net based on communication through adverse drug reaction relief system. In addition, we operate the Korea Orphan and Essential Drug Center to swiftly provide crucial medicines to people and prevent drug abuse through systematic management of medical narcotic drugs, in an effort to create a reliable society and a safe nation. Our loving mind is growing into love for the world. We foresee the trends of advanced science and technology and implement food and drug policy on par with the development level of South Korea. With smart approval evaluation and an advanced management system at international levels, we drive the innovative growth of the drug and medical device industries. In addition, we provide technical support for all cycles of the bioindustry, which is at the heart of the Fourth Industrial Revolution. From clinical trials to approval for sale, as well as present international standards through scientific R&D to contribute to technological development for food and drug safety. Our relentless efforts are making South Korea one of the world's 5 powerhouses in the food and drug field. Relief beyond safety. Trust beyond relief. Happiness to the people. Vitality to the industries. We will increase the value of our country. We will prove our love for you by realizing the happiness of the people. Science of love for our people. The Ministry of Food and Drug Safety.
안녕하십니까?
Hello.
The fourth MFDS Global Conference on Foodborne Antimicrobial Resistance is beginning. And my name is Ji Yeon-jung. I am from the Livestock Product Safety Policy Division at MFDS. I will be your host today. First of all, I would like to thank all of the participants from home and abroad for participating today, both in person and online. I welcome you to the conference. Thank you. The Global Conference on Foodborne Antimicrobial Resistance started in 2021 and marks the fourth year this year. This conference has regulators, research institutions, academia, and professionals and experts in the AMR field gathering together to talk about the AMR management system and research trends. This conference is held under the theme Global Cooperation and Solidarity to Combat Foodborne AMR. With the opening ceremony today, we have 4 sessions prepared for you, both today and tomorrow, with 14 presentations. Also, this conference is being streamed live in both English and Korean in MFDS YouTube channel, and after the conference, the presentations and materials will be uploaded on our official website. And now we will begin the 4th MFDS Global Conference on Foodborne Antimicrobial Resistance.
To officially open the conference today, we had originally planned Mr. Tae-won Cho, Director General of the Food Safety Bureau at the MFDS, but due to unfortunate circumstances, he's not unable to attend today. Instead, our Director of MFDS, Sung-il Kim, will deliver the opening remarks on his behalf. Please join me in welcoming him with a big round of applause. Greetings to all. I am Sung-il Kim, Director of the Livestock Product Safety Policy Division at the Ministry of Food and Drug Safety. It's my sincere pleasure to welcome you all to the 4th Global Conference on Foodborne AMR. As you all know, AMR is a global challenge that threatens food security and safety, public health, and sustainable development. And tackling this challenge requires close cooperation among all nations. In response, the MFDS of Korea is actively engaged in addressing this pressing global issue by fostering cooperation and taking proactive measures to reduce AMR, and we are committed to expanding these efforts in the years ahead. As part of this commitment, the MFDS has organized this global conference for 4 consecutive years, and this year the theme is Global Cooperation and Solidarity to Combat Foodborne AMR. We aim to share the diverse initiatives led by various regulatory agencies, research institutes, and international organizations to reduce AMR. This year's conference will specifically focus on strengthening coordination with Asian Pacific countries, sharing surveillance strategies from Europe, North America, and international organizations, and exploring response measures that leverage the latest technologies. In 2 days, a political declaration on AMR will be announced at the UN General Assembly in New York. This further underscores the significance of today's conference. The discussions and presentations during this event are expected to lay a strong foundation for reducing AMR and creating a healthier future for both humans and animals. In closing, I would like to extend my deepest gratitude to all participants, both online and in person, especially to our distinguished speakers for their invaluable contributions. Thank you so much.
Thank you for the opening remarks. In the UN General Assembly, AMR He also emphasized that there is meaning in these conferences that we have on AMR. And next, although she was unable to join us in person due to her commitment at the National Assembly, Minister Oh Yoo-kyung, Minister of MFDS, has prepared a welcome message for us through video. We will now watch the welcoming remarks from Minister Oh Yoo-kyung. Good afternoon. I am Oh Yoo-kyung, Minister of the Ministry of Food and Drug Safety of Korea. This year marks the 4th MFDS Global Conference on Foodborne Antimicrobial Resistance, and I sincerely welcome all participants, both in person and online. I would also like to thank FAO Deputy Director General Thanawat Tiensin for his congratulatory remarks, as well as all presenters and moderators at today's conference. Antimicrobial resistance is an issue that affects both human and animal health, food and environment, including soil and water. It is an issue that requires global collaboration and resolution across various sectors. To wisely overcome the threat of antimicrobial resistance to human health, it is crucial for us to share good policies and latest technologies implemented in each country and establish a comprehensive response system. The Ministry of Food and Drug Safety is working closely with domestic and international regulators and research institutions to manage AMR from food production to consumption. Especially with FAO, we are actively supporting capacity-building projects to contain AMR in many Asian and Latin American countries. I hope that this conference serves as a platform for exploring various ways to overcome the antimicrobial resistance crisis by building empathy and solidarity. Thank you very much.
Let's give it a round of applause. We have just watched the welcome address from Minister Oh of the Ministry of Food and Drug Safety. In her remarks, she emphasized how crucial it is important to share policies and research among countries at this conference in order to wisely overcome the global crisis of AMR. Thank you so much, Minister. Next, to congratulate us on the opening of our conference, we have a special congratulatory message from Mr. Thanawat Tiensin, Assistant Director General of the UN FAO. Let us all watch the video from Mr. Tiensin together.
Good afternoon, everyone. Annyeonghaseyo. Honorable Ministers for Food and Drug Safety of the Republic of Korea, esteemed delegates, colleagues, and friends. Thank you for the opportunities to speak at this 4th Global Conference on Foodborne Antimicrobial Resistant AMR. We are here to address our critical issues, the fight against foodborne AMR, a global threat that demands immediate actions. AMR is already a leading cause of death worldwide. Without decisive actions, AMR has the potential to cause a loss of 3.8% of global GDP by 2050. The global antimicrobial use in agri-food system is pressing a significant burden on our sectors to take the lead in combating these threats. Yet we have the ability to make a difference. Tackling AMR is essential for saving lives, protecting the planet, and securing our economies. FAO has made addressing foodborne AMR a core priority, linking it to our broader missions of transforming agri-food system for a better future. The One Health approach brings us to work together. That's why FAO is part of the Kodai along with the World Health Organization, the United Nations Environment Program, and the World Organization for Animal Health. Together we are stronger, and our collaboration is key to tackle AMR from all angles. FAO's 10 years global initiative to reduce the need for antimicrobial on-farm for sustainable agri-food system transformations, known as RenoFarm, is one such example of action-oriented solution. It supports countries in collecting and sharing AMR data, driving stronger governance and informed decision-making. The Republic of Korea has played a crucial role in leading to Codec ad hoc intergovernmental task force on AMR. Thanks to Korea leadership, we now have Codec text that guide countries on how to analyze the risk of AMR, how to improve surveillance and monitoring of antimicrobial use, and most importantly, how to contain and minimize AMR. Through the ACT projects, the Republic of Korea has helped us translate Codec guidelines into action in countries such as Bolivia, Cambodia, Colombia, Nepal, Mongolia, and Pakistan, training scientists and supporting farmers to reduce antimicrobial use. Korea's efforts set an inspiring example for the global fight against AMR. FAO stands proudly beside you in this mission. Let us continue to share experiences, build on successes, and work together for a healthier, safer, and more sustainable future. I wish you all the best for productive conference. Thank you. Kamsahamnida.
Thank you to Mr. Tianxin, FAO Assistant Director General, for taking the time out of busy schedule to send us this warm congratulatory message. In his remark, he emphasized the need for the international community to make concerted efforts across various sectors in response to global antimicrobial resistance. Thank you once again. This concludes the opening ceremony. We will have a short break to allow for group photos and venue arrangements. The conference will resume at 1:20 p.m. with session 1. Before we begin the first session, we will have a group photo session. I would kindly ask all distinguished guests, speakers, and moderators who have graciously taken time to attend this conference to please come up to Without further ado, let us officially begin the 4th Global Conference on Foodborne AMR. The conference will be held over the course of 2 days, today and tomorrow, with a total of 4 sessions. Today, on the 24th, we will have sessions 1 and 2 featuring presentations from 6 speakers. Tomorrow, on the 25th, sessions 3 and 4 will include presentations from 8 speakers. Once again, today's conference and tomorrow's conference will be live streamed on the official YouTube channel of the Ministry of Food and Drug Safety, and the presentation videos and materials will be uploaded to our official website. Now, let us begin the first session titled Sharing Strategies to Tackle AMR in Asia-Pacific Countries. Session 1 will be chaired by Professor Woo-hyun Kim from Gyeongsang National University College of Veterinary Medicine, who is known for his excellent research in the field of veterinary epidemiology. Please welcome Professor Kim to the podium.
Good afternoon, everyone. My name is Woo-hyun Kim, working at the Gyeongsang National University Vet School and as an associate professor. So I'm very honored to be in chair of first session of this conference. The first session we have 3 speakers who will talk about the strategies, how to tackle AMR in Asian and Pacific countries, especially 3 speakers from Thailand, Australia, and Malaysia. So welcome to the first session. And let me introduce first speakers for this session. First speaker is Dr. Julapon Srinha. Dr. Julapon Srinha, she's a senior veterinary officer of Division of Animal Feed and Veterinary Product Control of DLD, Department of Livestock Development. So she acts as a head of veterinary product and AMR containment section. She got a DBM from Containin University and received the MSc in toxicology from Madi Hall and also in food science and safety health from Heriot-Watt University, Edinburgh, UK. So please welcome her with a big applause.
Good afternoon, ladies and gentlemen. Nice to be here again because the first time in Korea is I joined the ad hoc on AMR task force in Jeju. Here is the second time. Thank you so much for inviting me to join again. This topic that I would like to share today, the topic is AMR containment strategy in Thailand. And I come from a Department of Livestock Development, so mainly I touch in the animal sector. Here is my outline. I have about 25 minutes to join some information from Thailand, my country, to do on the AMR containment. The outline of mine is the National Action Plan in Thailand, and I talk about our role in the Department of Livestock Development and in terms of the regulation in the vet drug and medicated feed. And we touch a little bit on alternative products and alternative way to do for reduce antimicrobial in our sector, animal sector, and also the gap sum and the next forward for us. Luckily, Thailand, we can say AMR containment, we choose on the political level. The plan of our country, Thailand, adopt at cabinet level. We have the like a prime minister to join the UN in New York UN Assembly and would like to have give the voice to combat the AMR among the global level. And the first round plan we do for in the cabinets as well. We also invite all multi-stakeholders to do, because everybody know the AMR is very complex context to do. Without the collaboration, the multi-stakeholder, we cannot achieve the goal that we do together. We can say we have at least more ministry that involve via human sector, animal sector, and also in environment sector. And luckily in Thailand, we have Thai FDA. Their department is under the public health to do like the secretariat in the committee of the project committee in MR. So because depend the country, but we think drug is very important. So if we have the strongly in the regulation on drug, sometimes we receive the success on this. To do like me to do among multi-stakeholder, among the discipline, is so many things to do. The left-hand side, we think we need to understand about the AMR, about the food safety, about the epidemic unit, because it's very complex. We need to know in depth and detail what's the different, what's the same, what the corroborate. And the right-hand side, we have more global level, country level, and so inside our country. So Department of Livestock Development, we work for like aquatic sector and so plant sector as well. If we understand more, we can communicate and give them the good message to them to understand and do together. The first law plan about 5 years. Now we finished the first law plan already, and the goal for agriculture sector is reduce antimicrobial use at least 30%. And here is the role of the DLD Thailand. We can see we need to develop more like the weapon to do. We have the mechanism like a committee, subcommittee, and we need to know the situation. We have the surveillance at the national level to know how's about the serious about the antimicrobial resistance. We have the lab sector. Luckily, FAO, we have a Chulalongkorn University, 2 different labs of the FAO in Thailand. So we work very closely in this sector. And we need to have the regulation, the containment, and the intervention to go to receive the reduced antimicrobial use. So we implement the like a regulation, like medicated feed regulation, and also we promote the use of them, seek for alternative. And also we work very closely with council and academic, like a curriculum. If I have personally in charge to do like a present about the vet school we do, to give them about the message. This is the strategy one. In Thailand, we have the strategy one to do for like a surveillance in the antimicrobial. And we have the Department of Medical Science to do for the focal point in this sector. And the main of our department is strategy 4. We do for MR prevention and control and antimicrobial stewardship in agriculture and animal. So we need to do more about the prohibit growth promoter, promote the like race without in farm, and also we have like strong implement in the good practice. Before we have GAP farm, GMP slaughter and something, but the more we have the MR to top up them, we like stronger on the communicate along the food chain. Return to the regulation. In Thailand, very complex because vet drug and human drug under the same drug, under Thai FDA and under Ministry of Public Health. We need to communicate to suit for the regulation in terms of animal sector. We can say Thai FDA regulate mainly on vet drug. But for my department, we work hard on use of them, prudent use, and also the medical regulation. And this is our goal. And we try to do for the prescription aspect. We stopped to use antimicrobial total ban since 2016, and all of them, we received the request from the vet drug regulation. All of them need the prescription. Today, we do and complete on this sector, but we try to do for all sectors, all drug in this like to use in our country like a prescription. Luckily, we have the medicated feed regulation, so medicated premix under the Vet Drug Act to regulate need to prescribe from veterinarian. And the rest of them, quinolone and cephalosporin, macrolide, and polymyxin, we need to prescription as well. For the medicated feed, medicated feed production is regulated on two things under the two acts. The medicated premix under the Drug Act, animal feed under the Animal Feed Act. We need to mix two of them, and the medicated premix with the prescription in hand of the veterinarian and under my department of Livestock Development. We not allow mixed cephalosporin in feed because we found that use antibiotic via feed is the main of usage. I think more than 60% to use, so we need to focus on. If we regulate on this sector, we go to receive the reductions a lot. Now we have feed mills, about 80 feed mills. They cannot mix medicated premix in feed without they have a GMP of the manufacturer. They need to have the veterinarian who receive the training from the DLD control the mix in manufacturer. And also before they mix, we need to receive the prescription from the farm who has the veterinarian regulate on this. And now we focus on the farm mixer who need to mix in feed. The farm to mix antibiotic that they had a mixer. They need to under this activity under the regulation as well. We touch to try to near and in terms of the prudent use, so we not allowed to prevention as well. AMR and antimicrobial use is not very easy. We need to train. Although you receive the veterinarian, you learn about 6 years. You need to train in the term prudent use and the term of the AMR containment under the regulation is a new one. So we train a lot on veterinarian and also the multi-stakeholder to understand why we do what if we not do anything, what the serious about this problem. Here is would like to show about the document, the data, the report, and the guideline that we have done in our country, Thailand. And we on the website and report and send to the user who involved. Return to the goal. We reduce as 30% is our goal. We can say we achieved. Now we are on the process to do for 2 years, 2022 and 2073. And we would like to do 2 of them, 2 years of them, and we like to publish later on. We can say we join every training that we think is need to do for the system of war to report. Before we report by email, by the Excel file, but now we train on the animals and we join already. And everything, if we collect by the IT system, is very permanent. So we have the program to correct the data, enter the surveillance, and we have 3 systems in our system on AMR, and we would like to join another as well. Less with our is one is very important that we do like a quick win for the first round plan to reduce the antimicrobial use. And this is why the producer, the farmer succeeds, because they need to husbandry at farm level, the alternative, and focus on the biosecurity at farm level as well. We also to seek for the novel of the feed additive and animal feed to replace. If animals do have the good health, they now need use more antibiotic. This is my like a research in to use three of the herb to mix together and to use about the products. We found that the gut health is good and the production is not equal and sometimes better than we use antibiotic. Is I do last year, and like we need the corporation, we need the public to help us. We need to invite them to join World Antimicrobial Awareness Week and also the training on the PPP and the tool from the WOA as well. We join about Muscat, Oman, about the ministerial level, and also we just, Thailand just received the evaluate from the IHRJE, and we could say we received a higher score. Before 2017, we have just only the pen. But when 2022, we improve all sector, and luckily for multi-sectoral coordination on MR, we received the highest score for 5. Not easy to join together, communicate a lot. And now we're just waiting for WOA to give us the evaluation about now they do for the report. We had come together them 2 weeks in Thailand, and MR is a one area of the technique area to receive the evaluation. And also for my division, we have three area: animal feeds, safety, wet drug, and biological drug regulation, and also AMR. We have 3 areas to involve about AMR, and we hope we receive the good score. And not only we complete some of them, but we have the gap, we have the analyzed by in our sector, and we try to do the improve and for the next second round of the plan of Thailand. You can see the government, we have the budget, something is fluctuate in each year, and the fragment of the data we need to involve, join together about the system, easy and fairly to join. The more system, the more complicated. We need to seek for the good one for us. And about the lab sector and professional is insufficient as well and difficult to convene on some of them. Why if you not do, how about the trading, how about the effort, we need to communicate. For us, Thailand, for the develop, after we have the first round plan, the second round, we need to more in the detail of them, and we join. Many times I said that this plan, not my plan, not my department plan, is our plan of Thailand. But without you, we cannot success because it's very complicated and difficult to do. We can say we can keep the strategy, and we continue the first round plan, and we end on the strategy for the same, and we in-depth on the group of the drug. We face with the export country, we export them. We need to do for the ally from the trade, domestic export, and also the preserved drug for the human sector as a WHO, as a WTO, and the codex as well. You can see we have to reduce the antimicrobial use. It's some very important and preserve for the humans like CIA. Now we have a new WHO classification. Now it's HPCAA, like a cholesterol. And we just finished on the first national on AMR in Thailand. 2 days we have the joy about the life of 2,000 people attend the meeting, and face-to-face about 200 people, all multi-stakeholder. And you can see the upper of the organization like FAO, WHO, WOI, and UNEP. And under we have the agriculture to work together. In Thailand, it's not easy because we have livestock, some is progress, but we have aquaculture, we have a plan. Although they're slow, we need to do together in terms of agriculture sector under Ministry of Agriculture and Cooperative. We need to prioritize, we need to understand how to do, what to do before, after that to share of them and pick them in the containment together. DLD Thailand do as the focal point on the MOAC, my ministry. Understand our friend it's not easy for plan. We not have guideline for them, but we need them to do at the same. If the plan cannot use the prudent use, it have the impact in our sector as well. These are the share that I would like to share you today. Thank you so much.
Thank you for your presentation, Dr. Srinha. So I have something to inform you. Yeah, on the program, we are supposed to have the separate Q&A session after all three talks, but you know, I was informed that we're gonna have, we're gonna have Q&A session right after the talk. That's what you said, right? Okay, we're gonna have just separate Q&A session after three talks. Sorry for the confusion. So next speaker, of this conference, let me introduce the next speaker, Miss Jo Bartlett. She's from Australia. She's a senior microbiologist with Food Standard Australia, New Zealand. And she holds a BSc majoring in microbiology. And she's specialty of the microbiological risk assessment and food safety across the private, academia, and government sectors. And her work at FSANS contributes to the microbiological evidence-based underpinning national standard management and strategic science work and coordination of surveillance of the national food supply. So her talk is Australian surveillance of antimicrobial resistance bacteria in retail food. So please welcome her with a big applause.
Hey, thanks everybody, and thank you to the Korean Ministry for the opportunity to come and talk today about this work. It's exciting to I guess be able to talk about a surveillance project that I've been intimately involved in since its conception. So I'm going to be talking to you today about the Australian Surveillance of Antimicrobial Resistant Bacteria in Retail Food Survey Project, and I'm actually going to step you through I guess the initial development of this program, because I think that sometimes we don't see the effort that's required to get something like this off the ground. So, thank you. First of all, just a little bit about Food Standards Australia and New Zealand. So we are an Australian statutory agency within the Australian Government Health Portfolio, and our main function is to develop and administer the Australian New Zealand Food Standards Code. And so that code is a legislative instrument, and it's given effect by our state and territory and New Zealand laws. So FSANS doesn't do any enforcement. That is done by our state and territory jurisdictions in New Zealand, and we essentially develop the standards that they pick up into their laws, and then they enforce them. The other thing we do with other Australian and New Zealand government agencies is continuously monitor the food supply to ensure that it's safe. And so one of the ways that we do this is through a group called the Implementation Subcommittee for Food Regulation, and the particular group is the Surveillance Evidence and Analysis Working Group. So this group is essentially made up of representatives of all the different state and territory governments across Australia and then also New Zealand. And it supports the food regulatory system by implementing either binational or national surveillance and other essentially data gathering activities as well. And so the work that I'm talking about today was undertaken in collaboration with our Australian CWIG members and it's part of the Coordinated Food Survey Plan, and that's essentially a mechanism in Australia where states and territories and sometimes New Zealand will agree to provide resources towards a particular surveillance project. So I think that the introductory talks really covered this well. I think that we all appreciate why we're here today and the global threat that I guess AMR presents. And we do see up to 10 million deaths being predicted by 2050 by certain groups. But however, the burden of illness for AMR is challenging to estimate as well, and certainly an area that we need some more efficient estimates coming from so we can make better predictions in the future. So in terms of food, so why are we interested in food? Well, food's connected and sits at the interface of humans, animals and the environment. It's considered an important driver of AMR because it can transfer not just foodborne pathogens but also commensal organisms back to humans but also back to animals as well. And it's a key part of Australia's cross-sector approach to tackling AMR. So the intention is that eventually we can have data across all of the sectors and work towards an integrated surveillance project for AMR. And also in terms of resistance, while most foodborne resistance or foodborne illness is pretty mild, there are vulnerable populations, particularly in Australia, who will need antibiotics to get better. And so that's why food agencies like Australia and ourselves need to continue to monitor the food supply in terms of AMR, but also continue our general work of driving down foodborne illness rates as well. So in terms of support for the Australian surveillance plan, so this really came from our National Antimicrobial Resistance Strategy. So we have the current strategy at the moment, which is for 2020 and beyond. And so this recognises that Australia acknowledges that AMR is of national importance, affecting humans, animals and the environment and food as well. And so FSANZ was funded by the Australian Department of Health and Ageing to undertake this surveillance, and it's a really good opportunity for us to advance our evidence base in Australia because we've had very limited national surveillance of AMR in food up until this point. So in terms of developing the surveillance plan, there's quite a lot of time that was involved in bringing this together. So it really started in late 2020 and we got together a antimicrobial resistance expert scientific advisory group, and essentially they provided advice back to us on what we needed to incorporate into the surveillance plan and how we were going to go forward. So FSANZ also doesn't have a laboratory, so we had to undertake a procurement to outsource the laboratory component of the work, so the analysis and the AST testing. And then because of the way Australia is in its federated system, it took quite a lot of work to work with all the various state and territory governments to understand their resources and capability to be part of the work, because essentially FSANZ was the coordinator and developer of the surveillance plan, and then it was our state and territory governments that actually provided the resources and people on the ground who actually went out and collected the samples. So to coordinate everybody and get them all onto a achievable and reliable plan took quite a lot of time and work. It's also, the success of any surveillance plan is really in that pre-planning as well. So we spent a lot of time making sure that we really understood everybody's capability and resources to make sure that it was going to be, that everybody was going to achieve what we were setting out to achieve by September 2022. So in terms of the initial planning, so we've mentioned the codex text, and that was certainly something that we looked at and was a really great resource for the kind of information that we needed to take forward to our expert advisory group. We also referred back to the WHO integrated surveillance guidance as well, and of course had a look at the surveillance and methodologies by other international integrated plans, so DANMAP, the Canadian and US integrated surveillance projects as well. And we do have a 2007 survey that was done in Australia that we also looked at, and that represents the most comprehensive analysis of retail food in Australia prior to the project I'm talking about today. So essentially, we developed all the options, we put those to our expert advisory group. They provided advice back on all the different components. And so the components that I talk about today are those components that are outlined in the codex text that need to be considered for integrated surveillance. So in terms of the objectives, these are 4 boxes or 5 boxes that with short amount of text that actually took quite a lot of time to develop. So this was done in a consultative manner, and these weren't I guess, developed at the start. So these are really dependent on the decisions we made through the development process. And it wasn't until our kind of final meeting with the expert advisory group that these were agreed onto. And that's really because as you go along, you really need to know what kind of approach you're going to take to be able to develop achievable objectives as well. So the objectives for our surveillance were to collect contemporary nationally representative phenotypic resistance data for Salmonella, Campylobacter, Escherichia coli and Enterococcus in prioritised retail meat commodities, to collect data to identify the emergence of AMR to high importance rated antimicrobials in these bacteria, to undertake whole genome sequencing of bacteria displaying AMR phenotypes of interest and identify known resistance determinants, and to ensure our data was scientifically robust, reliable, defensible and comparable to international data and standards. So this surveillance is only for 1 year. So the other thing we wanted to do was make sure that we essentially had a foundational design that could be taken forward into an integrated monitoring scenario as Australia moves towards that as well. So the first thing we did was prioritise our food commodities. So again, this was based on Codex and WHO guidance. So the factors that we considered in doing this were the epidemiological and public health factors, consumption and production factors, where international data was also available and if commodities were represented in other surveillance systems, the potential exposure for AMR and existing data sources and data gaps, and also antimicrobial use patterns as well. And so we actually did a ranking approach with this, where we essentially did a score and we considered poultry, pork, beef, eggs, seafood, horticulture and dairy in the first round. And so poultry, pork and beef came out with the high score for this round, so they were selected. But the intention is that we will go back and look at the other commodities in future years as well. So once we had our commodities, obviously then we needed to select our key pathogens. So we considered the public health impacts of particular bacteria, but also their likely prevalence. So for those that have done food surveys before, you can spend a lot of money to look for things that are very low prevalence. And so we selected Salmonella and Campylobacter for chicken because we know that they are prevalent at not high levels, but levels where we wouldn't have to spend a lot of money to pick them up. But for pork and beef, the prevalence for those in Australia for Salmonella and Campylobacter is low. And so for these, we included E. coli and Enterococcus as the bacteria that we looked at. And that's because these are reservoirs of resistance genes, but also they are key medically important bacteria in human health as well. So a lot of work in Australia in the other sectors is looking at E. coli or Enterococcus, and so being able to link in with them was also important. And so the isolates would then go through to MIC, so micro broth dilution, and then go through to whole genome sequencing as well. And we were actually able to get all of our jurisdictions to agree to an active random sampling plan. So we did consider passive surveillance, but we were quite keen to be able to do an active sampling plan for this particularly for this stage, but also because we didn't have data sources across the jurisdictions that would be useful in a passive surveillance. So once we had our commodities and bacteria, we then needed to determine how many bacteria we were trying to target for each food microorganism combination. And so this is really around what was affordable, but also, more importantly, what was going to provide the most reliable, robust and accurate data. And this was to achieve key objectives of estimating the prevalence of resistant isolates in a population, so it was key to our statistical analysis at the end, but then also to determine the emergence of resistance. So we were keen to be able to pick up low-level resistance in this first round as well. And so what we came up with was 200 isolates per food microorganism combination. And that also represents a value that's not too dissimilar to what other groups are doing internationally as well. So once we knew the target number of bacteria that we needed, we were then able to determine the number of food samples that we needed to collect across the nation. So because we could do multiple tests on either one chicken sample or pork sample, it was essentially based on whichever organism had the lowest prevalence. So this meant we had to collect 2,000 chicken samples, 2,000 pork samples and 1,000 beef samples across the country to be able to get 200 microbial isolates for each combination. So that meant we would have about 1,600 isolates going through to AST and whole genome sequencing at the end. So once we had that, we then needed to determine the types of samples we were going to collect and where we were going to collect them from. So we considered consumption patterns in Australia at this point, but also the prevalence of bacteria. So chicken with skin on was selected because it has a higher probability of having salmonella. And then also beef mince and pork mince were chosen. So they're fairly frequently consumed by Australians and also with a good likely prevalence of the target bacteria. We also looked at purchasing patterns and expert advice in terms of where we would actually pick these samples up from. And so we had 60% selected from large supermarkets, so that's Coles and Woolworths in Australia, 20% from small supermarkets, and then 20% from butchers that weren't within those supermarkets. And so then we had to allocate them across the country. So the advice back on this was that we should weight this by population. So on the chart there, the different population levels in Australia for our different states and territories, and that essentially represents the proportion of samples that were collected in that state or territory. So, of course, though, the other problem is that you can't randomly allocate samples across the whole state or territory. So we then had to come up with a way of limiting the range of where we were going to randomly allocate. And so we did this by choosing the greater region of our major capital cities. So we collected samples in Greater Brisbane, Greater Sydney, Greater Melbourne, Greater Hobart, Adelaide, Canberra, Perth and Darwin. And so essentially all of our jurisdictions have different, bodies and state regulatory bodies and structures in terms of how these samples were going to be collected and different resources. And that was key for us to understand as well, because you've got some fairly large differences. So out of Sydney, we had the team out there collecting 40 samples a week for 40 weeks. We did 40 weeks of sampling between September 2022 and then July 2023. But then compare that to Hobart with a much smaller population. They were only collecting 11 samples every 8 weeks, essentially. So once we had that all sorted out, we then had to randomly allocate these across these areas. And so on the graph here, I've just got an example from WA in terms of what we actually did. So with the greater metropolitan areas, for the majority of our states and territories, they then have smaller areas which are known as local government areas. And we actually can download spatial data for these, so boundaries that we were then able to upload into Google Maps and essentially then make the coloured, like the coloured zones that you see there. And so we made essentially 4 zones for sampling, and for the LGAs in each of those 4 zones, they were essentially the same population density. And then we gave the LGAs a random ID and essentially allocated we randomly allocated those using an online randomisation tool to various sample selections. And so what this meant was that we had a random allocation of our samples in space and not in time. So we did spread the sampling out in terms of bacteria across time quite evenly. And using this method with the downloadable boundaries, it also meant that our jurisdictions could essentially like pre-plan their routes. So they were able to, because these boundaries, you can't see them on the ground, right? So how were they going to, I guess, select the shop that they were going to go to? And so what we did was provide the Google Maps to them, and they could actually search for a supermarket within that boundary, and so they could pre-allocate, like have a driving route essentially of specific shops that they were going to go to. And so it allowed them to essentially pre-plan all of their driving routes before they went out. And I think that that was really useful to make sure, particularly for those that were collecting a lot of samples as well. Happy to talk more about that later because it's complex. So that's essentially all I'm going to talk about. So this just gives you an idea of where the sampling was happening, but also where the testing was undergoing. So we decided that it was really good to plan a national surveillance right at the end of COVID. And so we had quite a lot of concern that states would go into lockdown, that our perishable samples might get stuck in transport, and so we did want to, we decided it was important to have laboratories close by to do the presence-absence testing of the bacteria, and so the red dots are where those laboratories were, and then all the bacteria that were isolated were then shipped across to Murdoch University. Murdoch University has got a robotic system for doing antimicrobial susceptibility testing, and they also did the whole genome sequencing. So, and I guess apart from having a really excellent baseline for antimicrobial resistance in these commodities, we're really hopeful that this data will be able to contribute to other things such as microbiological risk assessment and exposure assessments, and analysing trends, contributing to future source attribution, being integrated into future surveillance as well, and helping us to have better policies, risk analysis and recommendations for antimicrobial use in Australia. And finally, just to acknowledge that I'm one person of a whole lot of people that was involved in this work. And so as of July 2023, our sampling was hugely successful. It could not have gone better. And that's really a credit to all of our state and territory jurisdictions that were involved, from New South Wales, Victoria, Queensland, WA, South Australia, Tasmania, NT and ACT. And of course, I can't forget the Australian Government Department of Health and Ageing, our expert scientific advisory panel, our laboratory collaborators, and also all the staff at FSANZ. So that's it. Thank you very much.
Thank you, Ms. Butler. Yeah, thank you for your presentation. Yeah, please keep your questions until we have last speakers. So our last speaker, is Dr. Noor Farah Binti Bakhtir. She's the head of the Infection Control Unit and the focal point for AMR and IPC at the Ministry of Health, Malaysia. She has been working over 15 years of experience, and she holds an MBBS from Mara Technology University and a master's in community health science from the National University of Malaysia. So please joining me welcoming her, the last talk.
Thank you so much, Prof. Kim, for the warm introductions. Good afternoon, everyone. First of all, I would like to thank the Ministry of Food and Drug Safety of Republic of Korea for inviting me to this webinar. So today I will share Malaysia's experience in developing and implementing our National Action Plan on AMR. Of course, I will be focusing more on the human health because I'm a doctor. All right. Next slide, please. So Malaysia journey to address, okay. So Malaysia's journey to address AMR actually began in 1998 with the establishment of our national surveillance on antimicrobial resistance, which was led by the International Institute of Medical Research, or IMR. And then, so over the years, Malaysia actually strengthened its policy, including the launch of our policy and procedures on infection prevention and control in 1998, establishment of healthcare-associated multi-drug resistance organism, HAMDRO, surveillance program in 2003, as well as the launching of our national antibiotic guideline first edition in 2008. And also the establishment of our Animal Fat Act in 2009. And following the, in 2015, following the 68th World Health Assembly endorsement of the Global Action Plan on AMR, Malaysia actually started our discussion in 2016, and we developed our National Action Plan at that time. And it's also led to the development of establishment of our National Antimicrobial Resistance Committee, NARC, with the 4 technical working groups. And in 2017, we actually launched our first Malaysian Action Plan on AMR, 2017 to 2021. So the NARC actually play an important role in coordinating and also overseeing our National Action Plan, guided by the and the key stakeholders to drive these AMR include relevant ministries, medical, pharmaceutical, and animal associations, healthcare institutions, healthcare practitioners, non-profit organizations, researchers, academia, and NGO. And our NARC is actually co-chaired by the DG of Health and also the DG of Veterinary Services. And it is supported by the 4 technical working groups. And these technical working groups is responsible in providing input, strategizing actions, as well as monitoring the implementation of all the measures in the plan. And for human health, we also have the National Infection and Antibiotic Control Committee, which also support the implementation of the strategic action plan. And NARC actually report the progress and the implementation of this National Action Plan, including the challenges identified and action taken to address those challenges. So Malaysia actually developed our second National Action Plan, 2022 to 2026, by conducting a situational analysis, including the National Health and Morbidity Survey, the KAP studies on antibiotic use, and MR, and we also used the track reports from 2018 to 2022, as well as the 2019 JEE findings for us to identify the critical gaps in order for us to develop the second National Action Plan. We also used the finding from 2019 WHO Integrated Global Survey on ESBL producing E. coli using the One Health approach, which is the Tricycle project, where Malaysia actually representing the Western Pacific region in this study. So basically, under our current My App AMR, we have identified a key priorities area to address the AMR more effectively, which include the public awareness and educations, surveillance and research, infection prevention and control, and last but not least, to optimize the antimicrobial use. We also have identified a few outcome indicators for our My App AMR 2022 to 2026. The first one is to increase the level of awareness, knowledge, and understanding of AMR among the public. The second one is to reduce the antimicrobial use in animal sectors by 5% by 2026 compared to the level in 2022. 30% critically important antimicrobial for humans and veterinary medicines, not used as a growth promoter in food-producing animal by 2026. Fourth one, at least 60% of overall antibiotics consumptions in humans comprised from SS group of antibiotic by 2026. And last but not least, 30% reduction of healthcare-associated bloodstream infections due to selected MDRO by 2026 compared to the rate in 2021. So we have seen several success during the implementation of our My App AMR, particularly in awareness, expanded surveillance and research, laboratory capacities, infection prevention and control, and AMS program, the vaccinations in humans and animal health, and also we managed to phase out the use of antibiotics as a growth promoters in agriculture sectors. So I will share with you some of the pictures regarding all these key successes. I'm so sorry because some of the picture did not come out in the slide. So raising awareness actually have been a critical component of our AMR strategy. Every year we have conducted the World AMR Awareness Week through a variety of activities, including webinars, forum, fun runs, and seminar. And in addition, we also conducted the AMR activities with other national events such as the Malaysia Agriculture, Horticulture, and Agrotourism Show, or during the Wellness Month. Recently, this year, we also successfully organized a roundtable discussions with the members of Parliament. This is collaboration with the British High Commissions. And we also have an engagement sessions with the Parliament Special Select Committee on Health at the Malaysian Parliament to brief on regarding our initiative in MOH, Ministry of Agriculture and Food Security, the National Water Research Institute of Malaysia related to AMR. So basically, this program aims to increase the awareness and support for AMR initiative among the parliamentarians. We also conducted numerous awareness campaign and educational program across the different regions, involving stakeholders from professional groups, farmers, veterinarians, food handlers, and public. For example, we have conducted the My AMR conference recently to increase the awareness among the health professional, seminar on AMR awareness among the non-livestock, agriculture, and environment sectors policymaker. This is funded by the My Ohun, to emphasize the AMR awareness among policymakers under the ministry or agency outside the livestock sector. And under the initiative of this tripartite program, working together to fight AMR in Asia, the Pacific Public-Private Partnership was conducted, which involved participants from various associations and industries in the animal health sectors. Another important component is the community empowerment programs has also been crucial. So for example, we disseminate the knowledge of AMR to the public during Know Your Medicines ambassador programs. And this program actually empower community leaders or representative in their locality to deliver information regarding AMR. We also produced promotional videos and posted it in our social media and also in our My OHA websites. We engage with the social media influencers where they also created the AMR promotional videos and share it to the public. And we also work with the universities to produce AMR educational toolkits. And we conducted, in order to ensure that our AMR message actually reach as many people as possible, we also conducted a various TV and radio campaign. And we developed and widely disseminated educational materials such as e-poster, infographics, brochures, pamphlet, and educational slides. And all this material were uploaded to our My OHA websites and can be downloaded to be used during training and awareness campaign. These are the example of educational or campaign materials. And some of the articles on AMR were also published in our social media, printed media, magazine, and newspapers. This one is another milestone for Malaysia. We actually launched our antimicrobial resistant diary during the 3rd AMR symposium. So this diary actually is a compilation of personal stories from patients, family members, and healthcare workers impacted by AMR. So you can actually read the AMR diaries through the websites. Okay. We also conducted a few KAP studies on the appropriate antimicrobial use among the public health, veterinary personnel, livestock, and aquaculture industry. For example, between April 2022 and March 2023, one of the universities actually conducted a study on socio-demographic factors and public knowledge on antibiotic resistance. So basically, based on the study, we found out that the knowledge is still low among the Malaysians, and basically the educational program should engage more younger and lower socioeconomic population to increase their awareness on AMR. This one is another new initiative that we launched this year, the proper disposal of patient medicines for the Environment Sustainability Program, or MyMediSafe. This initiative is a collaborative effort under the National Environmental Health Action Plan in Malaysia. So with over 700 collection centers and the support of more than 30 strategic partners, which include pharmaceutical-related associations, privates and universities, hospitals, community pharmacy companies, pharmaceutical companies, medication disposal service providers, and health advertising company. This initiative aims at educating and encouraging the public to dispose their medicines properly. And this program is basically to ensure that the environmental sustainability and also to prevent the AMR. On the surveillance part, we also have continuously monitored our AMR trends in human, animal food products, and environments. For human health, we actually seen an increased participation in our national surveillance of antimicrobial resistance from the medical institutions, and we also continue monitor the community-acquired infection, particularly resistance E. coli in the urinary tract infections. We also have successfully implemented the point prevalence service on antibiotics and healthcare-associated infection, particularly the HA-MDROs and MDRO bacteremia surveillance. And also, this HA-MDRO and MDRO bacteremia surveillance is one of the key performance indicators for our Director General of Health, and it's actually helped us in providing us with valuable data for further actions. We actively share all the data, these AMR and AMU data, through the GLASS, TRACS, NMUs, and WPRACS. So regarding the research, our research and collaboration effort have actually been fruitful, leading to increase in publication of AMR. As I mentioned earlier, in 2019, Malaysia participated in the tricycle projects. And in 2019, we continue with the Triumph project. Triumph project is the improving of the tricycle protocols, upscaling to national monitoring detection of CPE, and WGS pipeline for One Health surveillance. So this Triumph project aims to monitor the prevalence of AMR, especially the ESBL, E. coli, and CPE, through a One Health approach involving human health, the food chains and environment. And this project is still ongoing and expected to conclude it by the end of 2024. So as I mentioned earlier, all the report were uploaded and freely accessible in our MyOHA websites. Not only the report, you can also download the report manual, guidelines, SOP, research, educational materials from the websites. So with regards to infection prevention and control and biosecurity, we produce numerous educational materials related to IPC. So recently, our infection control unit, in collaboration with the WHO, UMMC, and the National Institute of Public Administrations and the Malaysian Infection Prevention and Control interest group, we produce an IPC online module. So this IPC online module aims to enhance the IPC knowledge among the healthcare workers, and it is designed for self-paced learning and utilize a variety of multimedia tools, and it is available under the EPSA platform. However, it is in Bahasa Malaysia, so and there are 7 modules which cover basic topic related to IPC, such as the hand hygiene, transmission-based precautions, standard precautions, PPE, and others. Okay. In service training of for infection prevention and control, we also regularly conducted the in-service training at the national, state, and facility level throughout the years in the form of conference, seminars, and workshops. So apart from the Ministry of Health, we also invited the non-MOH healthcare facilities, including the university, Ministry of Defense hospitals, the private hospital, to participate in this seminar. And IPC training is also integrated in the orientation program for healthcare workers. For example, the patient safety awareness course for house officer, where we actually included the IPC and AMR topic. And our Malaysian National Immunization Programs actually protect against 13 major childhood disease. And this vaccination service offered free to all Malaysians at the government health facilities and for school-based vaccinations. And the private healthcare facility also offer immunizations of the NIP vaccines and additional vaccine. Additionally, there have also been continued focus on ensuring the safety and effectiveness of animal vaccines, with significant achievement in controlling the disease such as brucellosis, rabies, and foot and mouth disease through vaccination program across the livestock and pets. With regards to the AMR, AMU, and AMS, we actually successfully review and publish a few guidelines. First one is National Essential Medicines List. Recently, we launched our National Antimicrobial Guideline during the MyAMR conference. We also have updated our protocol on AMS program in healthcare facilities. This one covers both hospital and primary healthcare. And we also produce national surveillance on AMU every year and presented it during the National Infection and Antibiotic Control Committee meeting and the NARC meetings. The other efforts to improve the AMS programs among the healthcare professionals include the AMS training for house officers during the orientation programs, mandatory AMS online module for medical practitioners, for public, AMS workshop for the private sectors, and also we have a well-established AMA training and credentialing program for pharmacists. This is initiated by the MOH. And AMU activities and animal and agriculture has also made a significant progress. Surveillance effort actually expanded with more farms and premises involved in active and passive monitorings. Additionally, we strengthened the enforcement where we more than 500 as of August 2024, over 500 monitor manufacturers, sellers, and importers of animal feed were monitored. And Malaysia has also successfully phased out critically important antibiotics such as the colistin as growth promoter and for prophylaxis since 2022. Furthermore, we also have the incentive program which promoting the MyGap certifications, which actually increased. We have seen that there are increased a number of certified farms and premises. So despite all the our success, we still have faced several challenges in implementing our MyApp AMR. The first one is with regards to budget and financial. Our national action plan is the second national action plan is currently not costed. So yeah. We have limited budget and financing for some of the activities, particularly, in conducting the awareness programs, surveillance programs, and also in order to conduct the training programs. And in terms of the human resource, we have shortage of trained staff, particularly in conducting the surveillance, genome sequencing, data analysis, and for the WhoNet data analysis. And with regards to governance and policy issues, we can see that some of the legislation related to AMR fall outside our jurisdiction of certain departments, so it making that the enforcement activities quite challenging. And additionally, there are there's still lack of political commitment in some of the agencies. And also, despite the success in raising awareness, we still need stronger engagements with various stakeholders, including the media and the public. And technical and logistical issues, especially those related to advanced IT system for data analysis and reporting. Data integration and sharing across sectors have also been an issue for us due to different data management system and also varying level of infrastructures and capacity. So environmental surveillance presents its own sets of challenges. We identify there are potential gaps in our effort to monitor and control emerging AMR threats and coordinating multi-sectoral efforts. And last but not least, to reduce the antimicrobial use in agriculture is also a challenge to us because we struggle to balance the need for this drug to maintain the animal health and the importance to reduce the AMR risk. In conclusion, the MyApp AMR 2022-2026 has made significant progress, particularly in the raising awareness, surveillance, research, IPC, AMS, and capacity building. However, it is important for us to address the ongoing challenges with regards to sector coordination, stakeholder engagement, funding, human resource, data management, technical integration, and antimicrobial use in agriculture. Okay. So once again, thank you for the organizer for inviting Malaysia to this important event, and thank you so much for your attention.
Thank you. Yeah, thank you for your talk, Ms. Pakatia. So now we are moving to the Q&A session. So let's bring all the speakers on the stage. Would you mind, to come over? So I'd like to thank all the speakers for their talk about, their strategies and experiences, how to control the AMR, in their country. So, and also thanks to all the audience for your patience and attention. So let's have a Q&A session. So let's open the floor for the question. Yeah, can you get the microphone?
Thank you very much for your presentation. I think we couldn't have started the meeting in a better way. The quality of the three of them was just excellent and very impressive. And I have a question for each of the speakers. So if it's too much, then we can follow up in the coffee break. We can start with the Thai colleague. I was in Thailand about 5 years ago, and I could see that there was a lot of great work on AMR. And the progress that you presented is really impressive. So the first note is congratulations. I think the progress is very good. Of the things that you presented, a lot of the focus was still on even further reducing the antimicrobial use in animals. And we see that in many countries. For example, at the EU level, we reduced 44% at the EU level. But despite that, the use in humans has not reduced much. So that was the question, if in Thailand you are also looking at the reducing the antimicrobial use in humans. That's the first question, and I'll follow up.
Thank you for the questions. For Thailand, both human sector and animal sector do the same on collecting the data on antimicrobial use. The first we not have any data at all. We have just only the research from the human sector in terms of the antimicrobial use in the human. So we start with the material we have. We use AI in collecting from the Thai FDA, and we do together. After that, we separate the responsibility. We assign in terms of the committee on the policy. We decide Thai FDA to do for the correction. After that, the human sector, they do themselves under the Ministry of Public Health. In our side, we do for the MOAC, Ministry of Agriculture and Cooperative, and DOD do. So we use, for us, the data we have, not the good data because it's very crude, because we use like AI and cover with the population in human sector. Anyway, they have many intervention to do on themselves in human sector, and they monitor, and our sector, agriculture sector. We, let's say, as a whole, we review as an AI in the all sector, but now we need to, for each sector, we need to monitor more in the next round plan. So in Ministry of Public Health, they have so many departments to do together with Thai FDA. Anyway, for the data, Thai FDA is the main to do for. Thank you.
All right, thank you. A question for Zoe on the sampling. I think it's very pleasant. Well, it's very pleasant to see that the documents that are developed internationally were useful. Sometimes we feel that we produce all these documents and then it reaches the country and then they are not useful. So it's good to see that they are. And thank you for sharing the roadmap that you did from these documents that we develop internationally to actually the sampling at the field level. So it was very pleasant to see. And it seems that you have very good data, or at least the sampling protocol seemed very solid. How far are you in sharing that data internationally, or is it already available? Once you have it, is it already available, or the plan to make it available internationally?
So at the moment, we're currently finishing the analysis and reporting phase. So being the first time that we've done this as well, it's probably slower than what it will be the next time. And a report will be released publicly, and it should be around the end of the year, because we've got a few endorsement steps and whatnot that we have to do in the first instance. So I expect it towards the end of the year.
Cool. And I think you know that FAO developed this platform to collect this kind of data. So if in the future this data could be shared in the platform, that would be super good. But if it's already at the public, that's wonderful news. And the final question to the colleague from Malaysia. You mentioned the point that many countries struggle with the safe disposal of antimicrobials. And the story is long, because when you go to the pharmacy, sometimes you buy antimicrobials that you don't use at the end. At the farm level, the cow dies and you have this antimicrobial for that cow, etc., etc., etc. So it's very complex, both for human and for the animals, like what to do with that. And I knew an example from Costa Rica, that they have a similar program, a safe disposal program. But there's very few countries that are doing it, so congratulations on doing that. So you have the program, and my question is, what do you do with that? So you have the safe disposal. That's already good news for the user. We have antimicrobials that we don't use. At least we know, at least in Malaysia, where to go. And what happens to those antimicrobials? Are they incinerated? What happens when people give them to you?
Thank you so much for the question. So for Malaysia, we actually have, for all the healthcare facilities, whether it is public or private, we have a company which actually collect all these medicines and bring it to the designated incinerations to be incinerated. So that is how all these medicines are, we collected from all this center. And for this project MediSafe, is going to be the same. The company will actually collect all this medicine and bring it to the designated area for the incinerations. We have this company where can actually do this incineration process. Yeah.
We still have time.
Thank you very much. It is really good to hear from your stories, and thank you MFDS to give us opportunity to share your stories, your challenges and achievements from around the world. I have one question to everybody. We are all here to work AMR, but it is not easy to see the impact of our work. So I have a question to you. How do you keep AMR as a high priority in your country? And how would you encourage policymakers to put a lot of resources to you to work? It is always challenges for us. Thank you.
Okay, let me first. Thank you so much for the very useful question. We think, personally, myself and our core team on MRI in Thailand, both human sector and animal sector, to keep the tone in terms of policy level is not easy, because if you in the country about the income, about the sufficient food, the prioritize a policymaker, not easy to talk about food safety, AMR containment. How's about very hard to communicate, especially not the scientific like the policymaker. Right. Anyway, luckily for my country, Thailand, we export a lot. I talk about the sector, and in terms of human sector, the public like the healthcare in Thailand very is a good level, and for livestock sector, we export in the premium market like Japan, EU. Both I think the pressure and the context suit for the politics need to concern is very important, the context. So this is, we need to keep what the key point to send them the message about the importance of the MI we need to do. We said that if we not do for our sector, livestock sector and export country like us, we need to let the message to the upper level, the policy level, to let them to know what the important. If we not do in this area, how the impact. If we have received the third export, like a global level, like a boiler, we need to keep them, and the standard is upper and reach the market to need. And luckily we join the codex, every standard we align. I think this is a key. So depend the country, what you used to read the message, suit for the political level to understand what the important and how the impact if we not to do anything. Thank you.
All right. Thank you for the questions. I think it's a very good questions. So how Malaysia do it? So in order for you to engage the political or the policy makers, sometimes you need people from outside. For example, as I mentioned earlier, we had engagement with our parliament, members of parliaments, where actually we get the help from the British High Commissions, when they actually come and they do the engagement. Sometimes, you need some people outside of your country and to come and help and to poke them, to ask them, hey, look, this is very important. Yeah, so this is very important. So one of it, maybe you can use that. You can also use the WHO, the FAO, the quadripartite members, have an engagement with your policymakers or your political people to buy in, with regards to this AMR. Yes, of course, you need a continuous engagement with all these policymakers, the political, sometimes, and also engagement with media is also very important. Once the media, they posted some things in the newspaper or in the social media, all these parliament members will get shocked, and they will start, asking, okay, what are we doing? The ministry doing? So that's how we actually engage them, and yeah, continuous engagement is another important part lah. Because sometimes this policy maker, I'm not sure about other country, but for Malaysia, sometimes the policy maker, the people keep on changing. You need to update them, a few times. Yeah, thank you.
Thanks very much for the question. I guess something I've been trying to look at more is identifying the links and how AMR and focusing on AMR can actually be incorporated into important things in another area. So, for example, in terms of food and food surveillance, having general surveillance of bacteria is important and key, and that kind of work actually benefits other areas, not just AMR. And so adding on AMR into food surveillance and those kind of things is a natural step. But also in terms of general benefits as well. So highlighting that, addressing AMR in animals and animal use is actually more about promoting good practice and good husbandry and those kind of things, and bringing through alternatives. And all of that also has a benefit downstream in terms of food safety as well. So coming from my space, which is food, trying to find how it links and really showing that it's a natural step. It's actually helps us do all the other work that we're doing as well. Thanks.
Thank you all very much. My question is for Zoe. I was wondering about the traceability of your samples, whether you know what processing facilities they come from, and even further back, how much representation you have of your production systems with your sampling scheme.
So we do, so for some food samples, they would be packaged, and so there will be information on where they have come from. It's not the intention of this survey to pull that information out. For butcher samples as well, obviously they come without a package and that kind of thing, so some of that traceability isn't there. Also as well, it was up to the states and territories if they decided to get more information, they may have received that, but in terms of what we're looking at, we're just trying to focus on that national picture. But I guess in Australia as well, there's kind of unique scenarios around manufacturers, and it's actually, it's quite the same manufacturers, quite spread out as well for a lot of our commodities. So,
yeah. Sorry, thank you very much for the great presentations. I certainly learned a lot. You've just talked in answering a question about looking at exports to make sure that AMR stays high on the list of priorities in the case of Thailand, and also the importance of engaging other parties and looking at other sectors. And I was wondering, in general terms, what is the role of the private sector in pushing forward those policies on AMR? Thank you.
Okay, in Thailand, we we said that the private sector is very important, and especially in livestock sector and animal sector, they play like a role of the player in AMR containment. Without any collaborative the action, we cannot achieve the goal that we set. For example, we have variety of the species, swine, pig, and broiler, and poultry. For poultry, if we invite about 10 big company, is a private sector, to understand us, they can change the tone and can reduce the program and antibiotic use. For example, if the broiler sector, they give up or not use the cholesterol, the cholesterol is gone in this sector, and it's a cover the population more than 80%, and we have variety of the species. We do for the prioritize who is the first prioritize who ready to do in terms of the containment. After they do, they finish this sector, we do for another. And we set the prioritize, and we do for the who ready to do. After we receive the success story, we can share another sector to follow. Thank you.
I can probably add a little bit to that as well. So in Australia, certainly the various industries are really engaged and very involved. So they're all doing lots of work in terms of developing their antimicrobial stewardship plans, and also very interested in the work that we're doing in the retail space, because the retail space is kind of a little bit different, because it's not just bacteria from animals, it's also bacteria from people that are producing it and those kind of things, and that's where FSANZ is in a good position to do that analysis. But certainly the industries are really involved and connected in terms of that work and interested in the outputs as well. So, yeah. Thank you.
Any more questions from floor?
네, 발표 잘 들었습니다.
Thank you for the presentations. And countries are grappling to tackle AMR, and I look forward to seeing fruitful results. And among them, I saw that Thailand has the goal of reducing 50% of AMU. Based on my past experience, there are antimicrobials with high resistance, and these are considered critically important antimicrobials. So it seems like we need policies to address antimicrobials that are highly important. And what kind of policies is Thailand focusing to achieve this 50% reduction in AMU?
Thank you for the very challenging question. So, okay, firstly, we have the baseline data 2017 in terms of the whole AI in the sector, in livestock sector and aquatic sector. After that, the first year of the plan, 2017, we have many interventions to forecast. We need, if we action more on this intervention, we receive the good result. For example, we do for medicated feed regulation. It's not easy to implement, because for, I think in ASEAN country, the farmer, the people can walk in to buy antibiotic before, very easier. Anyway, aligned with the reclassification of the Thai FDA, we need to follow. Medicated feed mainly we use antibiotic via feed more than 60%. If we do for the regulation on prescription in this sector, we think we receive the good result as the goal we set. After that, we promote RWA, rat without antibiotic, and we seek for which the species with the category its impact. We found that fattening pig is the species and the category to consume more antibiotic. So if we shoot broiler, normally mainly broiler not had use more antibiotic, the broiler sector. So we focus on fattening pig sector use antibiotic more. So we invite and have the activities to invite them to communicate them, and we have the media, and we give them the certificate after they succeed about the farmer who join the Red Without Antibiotic project. Many of the activity communicate and continue doing more and more and show them and give them the reflect and report every year, the year after year, and show them the progress of the activity under the plan. So we think all of them to show we can reduce antibiotic. Anyway, it is the whole AI. The next round plan and the second round plan, we focus on the CIA, HPCAA. We need to more about the communicate in depth of the class of the drug we need to preserve. This is mainly we keep. Thank you.
So we still have time. Let's get a couple of questions. Yes, go ahead.
And so a follow-up question to that is, are you seeing reductions in antimicrobial resistance with the reductions in antimicrobial use?
When we communicate about antimicrobial resistance and antimicrobial use collaboration, is it go together or not? It seems we cannot say like that. The farmer cannot use antibiotic about 5 years. Sometimes the situation antibiotic at their farm is not reduced. Anyway, although we receive the result like we face with, but we can trust that if we not use more and more antibiotic in many years, 5 years, 10 years, the reduction mainly that as a whole will reduce. Because I used to see about the data of the European EU, since they stopped to use antibiotic as a growth motor 2006, now we found they reduce. I used to attend a meeting. Some country do not use some antibiotic 10 years, but the resistance is not good enough. Anyway, for Thailand, we have some results very important. For example, we banned to use vancomycin, VRE. And now we can say the VRE in Thailand, not more than 2%, more than 5 years. That means if we stop to use and reduction of uses, the antimicrobial resistance as a whole at the next era, we think is better, but it's not aligned.
So let's get the last question. Yeah, please go ahead.
My name is Kyusungjo from Germany. Thank you for your talk. And my question goes to the Joy. I really want to know the beyond. You mentioned beyond this project and this surveillance. Because as a microbiologist, we knew that there are another high-risk foodborne pathogen, for example, Klebsiella pneumonia and Staphylococcus aureus. But in your surveillance system, we couldn't find any result related to those bacteria. So do you have any plan beyond this surveillance?
So I guess in terms of for Klebsiella and Staphylococcus, they weren't priorities for the commodities that we're looking at because we don't frequently see those. So that's kind of why I think that's probably the difference between maybe what the health sector would be interested in and what we're interested in. But in terms of, if the health sector was interested in looking at Klebsiella coming through and doing of interest to see if there was transfer through food that could be done. But in terms of generating data that we can use, we'll probably focus more on relevant pathogens for the relevant commodities of food. E. coli is probably the key one that we're focusing on at the moment that goes across all the different sectors. So, yeah, but certainly looking at other commodities and other bacteria that are relevant for those is certainly on the cards. Would be interested to do that. So, yeah, thank you.
Thank you for all. We are running out, but yeah, let's have a last question. So please go ahead. Yeah, we're still just one last question. Yeah, please go ahead.
Thank you. My question goes to Joe. Thank you for your presentation regarding the surveillance program with retail products. Normally, AMR comes from primary production. So from your study, what have you learned and what is your plan to integrate with the primary sector? Thank you.
So I don't have all the results to be able to tell you what I've learnt yet. But certainly, the intention of the survey that we're doing at the moment is having that baseline in terms of what we're seeing through retail food. There are lots of surveys. The industry has done quite a lot of surveys in animals in Australia. So there is data there for us to have a look at. In terms of how much it aligns and what we see, it will be interesting to see if there's patterns of resistance that are the same or different. But I guess in terms of, this isn't a source attribution study yet. So in terms of where the bacteria that are on the food that we're looking at have come from, we won't be answering those questions with this survey. But certainly if there's other sets of data that we can look at retrospectively, that's something that we might be able to do in the future. So really it's just that, it's giving us that baseline to start from and then work from there. So yeah, does that answer your question? Yeah, great, thank you.
Well, it's time to wrap up. Yeah, thanks again for all our speakers and all the audience yourself. Yeah, please give them a big applause. Thank you.
Yes, now we have concluded the first session. I think there was some confusion with the Q&A session, but thank you very much, moderator and Professor Kim, and also our three presenters. Thank you very much. Please give them a big hand. And now, before we move on to the second session, we will have a 20-minute break. The second session will begin at 3:15 p.m.
한번 안내 말씀드립니다.
Once again, we will now soon begin the second session, so please take your seats.
To continue, please take your seat in the venue. Thank you. 네, 지금부터
Now we will begin the second session of the fourth MFDS Global Conference on Foodborne Antimicrobial Resistance. This session will be on sharing of global strategies to contain in animal and agricultural sector. We will have 3 presentations. First, I would like to introduce our moderator for the second session. He's a national expert on antimicrobial resistance in Korea, and also he's actively conducting research in the field of antimicrobial resistance in non-human sectors. Please welcome Dr. Chang Won-yoon.
My name is Chang Won-yoon from Gangwon National University, South Korea. It's my great honor to be here and serve as a chairperson in this session. We will share the global strategy to reduce AMR in animal and agricultural sectors in this session. So we have 3 speakers in this session, and after finish all 3 presentation, we are gonna have the Q&A time and open to take questions. Okay, let me introduce our first speaker, the Daniela Battaglia. And Daniela Battaglia is Animal Production Officer at the Food and Agriculture Organization in the United Nations, FAO. Danielle holds 2 master's degrees, one with a major in agricultural science, animal nutrition, and the other in tropical animal health productions. She is currently responsible for the animal feeding and feed safety program, as well as for animal welfare programs. Daniela is a coordinator of the FAO Sustainable Livestock Technical Network currently. Okay, so stage is yours, and please welcome her with your big hands.
Thank you very much for the nice introduction, and of course, thank you very much to the government of the Republic of Korea for having invited me and giving this opportunity not only to share with you some information of what the FAO program of work, but also to learn and to hear from your interesting experiences. And I've also been here the last time during the Codex Task Force on AMR, hosted by the government of Korea, and I must applaud the government for its continued commitment of being a leader at the international level and for sharing information and experiences on AMR, the containment of AMR, and this conference is a proof of that, but also for supporting other countries with capacity development work, as we will hear later on, and also tomorrow from my colleague Jorge Pinto. So the strong commitment of the government at the international level in this sector. And now I would like to share with you a little bit of information on why it's important to address the containment of antimicrobial resistance in the animal production sector. And we have heard from the introductory speeches and also from the previous speakers how important it is to address this important threat, the one of the development of antimicrobial resistance. So I'm not going to go about that again, but I would like to point out how the animal production sector contribute to it through a massive use of antimicrobials. So we have several data that have been also shown before in the course of the day. But what is, it could be somewhat worrying is the animal production is definitely increasing at global level. We have seen very important growth in the last decades, especially in the so-called transition or emerging or low and middle income countries, so very much in Latin America and in Asia, in countries like China and India. So that growth is expecting to continue in the coming decades, even though there may be less meaningful, with less meaningful number, but is still expected to increase by 15% by 2040. And again, you can see in the graph the difference. Not all products of animal of origin are going to growth in the same way. So the biggest growth is still expected in the poultry sector, and so that you will see there the difference. Same growth is also in the dairy and the egg production. So animal source food is expected to increase. Here we have also some other data that are looking at the meat. The global meat output, again, expected to increase, and that's where we see the differences, not only by species, but also by geographical region. So you can, and I can appreciate that maybe it's not easy to read the slide, but you have your handouts, so you can have a little bit more information there, and these data are drawn from FAO statistics. FAO has a large project, a large program called FAOStat, where all government of its 190-something, 96 members are providing statistics on a yearly basis. So what is important is that the animal production sector is growing, and with that, the use of antimicrobials to tackle not only the health, but also the growth of animals is something that has to be considered, is something that is deserving attention. Now we have to see, we have different data that have been produced. So some data are predicting a 25% increase by 2040. The data I'm presenting here are mainly drawn by papers produced from Van Buckel and other authors. So these are the data that are predicting the global trend in increase of antimicrobials in the animal production sector. And again, these are the geographical dimension, so that is happening mainly in 2 areas of the world, Latin America, Brazil mainly, and also China, with a little bit of growth in other countries. At the same time, so again, the geographical dimension. At the same time, we have other data produced by an early survey that the World Organization for Animal Health is producing, and they're showing different data. So I'm showing both of them just to inform you that there is not one unanimous voice on that, so it's worth to look at the matter in a wider perspective. So the data from the World Organization for Animal Health are telling us, that at this time, this is 2021, 88,000 or almost 89,000 tons of active ingredients were used in the animal production sector, mainly ruminants, poultry, and pigs. Interesting data that from these early surveys are showing that there's been a reduction in 20% between in the last years that the survey was doing the estimate, so between 2016 and 18. So the decrease has been concentrated mainly in the Americas, in Europe, and in Asia and Pacific, where we have 9, 6, and 0.7 respectively degrees. But what is worrying that there is 117, in the same period, there is 179 increase in African countries. So obviously, where action plans for the containment of AMR have been developed and applied, we have already seen a difference and decrease in antimicrobial use and also antimicrobial resistance. The good news is in those countries where already for several years, like in the Netherlands, we have seen a decrease in the use of antimicrobial use. There's been a decrease in antimicrobial resistance. And that's what is prompting us, giving us some optimism, and is motivating us in decreasing the use of antimicrobials, because that translates directly in lowering antimicrobial resistance. However, a lot still needs to be done to decrease the use of antimicrobials in those countries where it's still increasing. So that's also some somehow good news, that 70% of the countries reporting to the World Organization for Animal Health are showing that the antimicrobials are not used as growth promoters anymore, but in still many countries, so 36 of the ones that are reporting is still used. And we have also to say that even though many countries by law are forbidding or phasing out the use of antimicrobial growth promoters, at implementation level is still not the case. So they're still very much used, even where they are legally banned. So this slide gives you a little bit of information on how much antimicrobials are used in animal production, and what is also worried that almost 22% of those are those of highest priority for humans, and 40% are critically important for humans. So again, these are the ones that we should mainly address when we try to reduce the use in animal production, and especially for growth promotion. Another interesting aspect, because in the previous slides we were mentioning, you were discussing about the importance of the disposal of antimicrobials which are not used. But another important aspect is that roughly, I mean, again, there are very different data on that, but I mean, many of those papers agree that roughly 80% of antimicrobials which are given to animals are excreted in the environment unmetabolized. So it means that they're contaminating the soil, water, and therefore plant production, crop production, or they're getting into the food chain, and so reaching the human beings. So again, that represents a very important source of potential antimicrobial resistance that needs to be tackled. So as I think most of you know, antimicrobials in animal production are used for different purposes, and so not only to treat sick animals or individual sick animals, but also very often to prevent diseases, so they're treated more largely at herd level, or, as we were saying, in many countries are still legally, or in any case are used to promote the growth of the animals or their product. So those are the antimicrobials. I think maybe that especially when medically human important antimicrobials are used, those are the ones that need to be tackled, very much reduced or banned or phased out altogether whenever possible. But to do that, so as we were saying, antimicrobial resistance is a global threat. It has been said also in the course of the morning, it deserves joint action at global level. It deserves or it needs different stakeholders to work together, so private and public sector together, intergovernmental organization and so on, and especially tackling the use of medically important antimicrobials is something that needs urgent action. But the important news is that there are some positive news in all that. A lot of times antimicrobials, and especially antimicrobial growth promoters, are used to cover up for poor management, husbandry management. So for poor hygiene, low animal welfare, not using the best adapted genetical breeds, not having enough biosecurity and safety in place. So addressing all those aspects, addressing with good practices, the genetic makeup, using the adapted breeds to certain diseases, increasing biosecurity, increasing feed safety, increasing the welfare of the animals, so increasing the hygiene, so overall a better management, husbandry level, could help decreasing the use of antimicrobials and especially the growth promoters, and at the same time contributing to other benefits, as was mentioned before, and that's maybe where we have more of a win-win. We can show that not only we will address antimicrobial resistance, but we will contribute to overall health of the animals, the economic sustainability, human health, because in many cases we're talking about zoonosis, so diseases that could be transmitted from the animals to human beings, the welfare of the animals, the quality of the product. So again, the many associated benefits to improving the overall management of farm and therefore decreasing the use of antimicrobials. The other good news is that through animal nutrition and good feeding practices, we could not only improve livestock productivities, but also making animals healthier, more resilient, increasing gut health, and increasing the overall health of the animals and their productivities, the feed efficiencies. Therefore, lowering the need to use antimicrobials either as growth promoters or for the treatment and prevention of diseases. There are a whole range of practices, we will look at them in a while, that could enable the genetic potential of the animals to express at its best, therefore increasing the efficiency of productivities, increasing the growth, and support the critical functions required by healthy gastrointestinal tract. Therefore, increasing the host defenses of the animals, and again, allowing a lower use of antimicrobials, especially the growth promoters. So again, this slide shows a little bit of all the different practices, all the different aspects that could be addressed to decrease the use of antimicrobials. So looking at nutrition, but also the use of vaccine, increasing biosecurity, better adapted breeds, and so on. So all of those has to be taken into account. Again, I was saying that there is a huge variety of practices that could be the feeding practices, animal nutrition practices that could be adopted to decrease the use of antimicrobials and also replacing the use of antimicrobial growth promoters if we want so. So we're starting by increasing feed safety, so reducing the contaminants with microbiological agent hazard in feed, but also addressing the anti-nutritional factors, ensuring the water is of a good quality, increasing feed quality, so making sure that the feed we give to these animals provide to their reproductive, physiological, and productive needs, and overall ensuring the gut health. So what are these practices? So there is a whole range of functional feed ingredients or additives that could be used. There is also a whole range of processing practices that could be used to make feed more efficient, more digestible, and therefore making it allowing more important growth of the animals, again, allowing not to use antimicrobial growth promoters to have that growth. FAO has been working at mainly producing and disseminating and sharing technical scientific information, so giving the opportunity to know in practical terms what needs to be done. So we have a publication that have tackling these matters, but we also we also have been looking at the policy aspect. So we have produced material to inform countries which kind of policies, which kind of legislation should be in place to allow a better knowledge and the better use of that scientific and technical information available, so to increase the use of those practices. We have organized an expert meeting, expert consultation last year, and we are producing the report of all range of experts from different areas of the world on different topics, providing information on what we know on how to decrease the use of antimicrobials, again, especially growth promoters, through better animal nutrition and feeding practices. All those documents are available online, so it's going to be easy for you to find them on the FAO website if you want. Especially the FAO report, the FAO meeting, expert meeting of last year, came to the conclusion that we have enough insight into animal nutrition physiology to know how to optimize nutrition, feed utilization, and therefore leading to resilience of animals to stressors and diseases. So animals, first of all, should receive a balanced diet, good, appropriate for their needs, which is safe. This diet could contain functional feed ingredients and additives that enhance the gut health and therefore make animals more resilient and more productive. There is a whole range, as I was saying, of different processing that make the diet more digestible, but there is also a whole range of feed additives that could be used. The special attention should be used in certain more stressful lifetime of the animals. So, for instance, the weaning, the changing of location, and so on. The application of precise feeding program is also very important because that allows us to give to the animals whatever is needed in the best possible way. And at that scope, a total nutritional approach has to be put in practice that look at the different stages of the animals, as I was saying, the ones that could be more stressful for the animal, the early phases of life, the transition phases, like weaning, for instance, the different production stages and so on. It looks at the feed processing technologies, but also at the ingredients and additives, making sure that they are safe, of adequate nutritional value, and also sustainable in a way. So that the report of the expert meeting is providing a whole list of different feed additives, for instance, that could also be added to the feed diet to make the diet itself healthier and to improve the gut health and efficiency of production. And we go from the antimicrobial peptide, the different probiotic, prebiotics, postbiotic, and so on, macroalgae, organic acid, clay minerals, enzyme. I'm not going to go through all the benefit and how they work and how they should be used, but if you're interested, again, all the information is in FAO publications, which are available online. A particular interest in the plant-derived products, and that's the so-called phytogenics, especially because in this region of the world, there's been a huge proliferation of research or production of those products, which are extremely interesting, especially because they're available at relatively low cost in many low and middle income countries. So they're more readily available to even small and medium enterprises and stakeholders. So again, available locally and not and at low cost. So there could be a very interesting alternative to the use of antimicrobials, especially the growth promoters. It's always very important to have enough studies and to have enough assessment that show that are safe for the animals, that don't present any anti-nutritional factors, and also they're effective as effective as the claim. So for instance, at country level, it's important to have adequate legislation, adequate risk assessment, to make sure that the farmers are going to have a product that is really doing what it claims to be. We are getting also all that information about good practices, about what is available and so on. At FAO, we have developed a web-based repository of all these different good practices, again, to make it available, that information wherever is needed. So we look at the different production system, we look at the different country of origin, different languages and so on. So that repository is available online. We're always looking for new information, especially from different areas of the world and different languages. So if yourself have produced any of that material, please get in contact with us. We will be very happy to hear about that. We will be happy to hear about success stories and to share them. So please send to us. And then I will refer to the work that is done, that has been done by Codex Alimentarius, again, with the help of the government of Korea, the task force, that is addressing some of these aspects. Also to the support provided by the Korean government in supporting countries in the implementation of those practices. You are going to hear about that tomorrow morning by my colleague, Giorgio Pinto, so I'm not going to provide that information now, but just to let you know that more is coming for you tomorrow, so keep tuned. And also you will hear about another FAO initiative to reduce the need to use antimicrobials in agri-food systems. It was mentioned again this morning by Tanawa Tenzin. You will hear again in the presentation by Giorgio Pinto, but just to tell you that all the information I just presented is going to be transferred at country level through FAO effort and its partners, so you will hear more about that tomorrow. Again, this is what Renofarm is addressing, and if you need more information, you can get in contact with me. We have mailing lists where we disseminate information about new publication, new events, and so on, but also you can have a look at the FAO website where all our information is posted. And with that one, thank you very much for your attention. Kamsahamnida, and I will be here for questions later on. Thank you.
Yeah, thank you very much for very enjoyable talk. Okay, so we are gonna have the Q&A time after finishing the all three presentation. Okay, let me introduce our second speaker, who is Kyu Sung-jo. Dr. Kyu Sung-jo is a principal investigator in the Department of Microbiology and Biotechnology at the Max Lubner Institute, the Federal Research Institute of Nutrition and Food in Germany. He holds the bachelor's degree and master's degree in the life science from Handong Global University in Pohang, Korea, and earned his PhD from Department of Chemistry and Biosciences from the Karlsruhe Institute of Technology in Germany. Okay, I remember he made a wonderful talk early this year in the another conference in Seoul. So it was very enjoyable for me. Okay, so Kyu Sung-jo, the sharing his strategy, especially in the agricultural sector. Okay, are you ready?
Yes,
okay.
Thank you so much for your kind introductions, and also thank you for you guys joining this conference. Actually, I decided, since this conference is being held in Korea, that I'll be able to speak Korean, to share presents in Korea. Is it okay for you guys? So now, time to use your instrument. Just switch on and focus at channel 1. It should be in English from native speaker. Okay, 감사합니다. 여기 첫 부분은 좀 out of recording.
Okay, so today I'm going to be giving my presentation in Korean. My presentation is going to be about AMR, of course, and everyone here knows that AMR is very important, but what is more important is that us experts and policymakers carry out activities on this, make policies. That's also important. But the most important thing is that people are aware of this problem, not just experts and policymakers. So I am a microbiologist, and I am going to introduce what my research is about and how my research helps raise awareness to the public. The title of my presentation is Investigation Antibiotic Resistance in Enterobacteriaceae from Fresh Produce in Agricultural Environments. The contents of my presentation is this, and as a lot of people noted, AMR is very important. In 2008, we have introduced the concept One Health. This is not just for human medicine, but One Health approach is focusing on the fact that AMR should be dealt with in many other sectors together. And here, I brought the One Health concept that is introduced in the WHO website. And in Korea, we are also discussing AMR both in humans and animals, and environment and food. In Korea, we also have a lot of projects and programs conducting research based on the One Health concept. So if we don't do anything, then by 2050, AMR could kill 10 million people per year. That was reported in the review on antimicrobial resistance commissioned by the UK government. And it's not just about the numbers. The important thing here is that we need to notice that climate change is contributing to the increase of antimicrobial drug usage, and this is leading to more death in humans. Also, during the COVID-19 period, CDC also noted that there was more than 40% of people who believed that antibiotics could be used to treat COVID-19. So a lot of people began to use antibiotics against COVID-19, and this shows that this led to at least 15% more death during the first year of the pandemic. And so I would like to talk about the global burden of AMR. In the World Economic Forum annual meeting, I was in Davos this year, they had a talk about facing a world without antibiotics. So this is a very serious issue, not just in the healthcare, and you can also check this video on YouTube. It's a very important talk. It's not just about us experts in the healthcare industry, but also the economists are seeing this as an important issue. As I have told you, World Bank says that we will be losing 3.8% of global GDP due to AMR if we don't do anything by 2050. And also, in 2021, there was a U.S. report which said that 6 of the 18 most alarming antimicrobial resistant threats cost the U.S. more than $4.6 billion on an annual basis. Yes, $4.6 billion. And I am also working in Germany, but in the 16th Berlin Agricultural Ministers Conference, there was a report that was published in 2024, and they said that all sector capacities need to be enhanced to prevent AMR in both humans and animals. WHO already knows the seriousness of the issue. With the COVID-19, we have now witnessed what the pandemic can do to us. And antimicrobial resistance is called silent pandemic. So just like any pandemic, it can be a very severe issue. It's not going to be as direct and as fast as COVID-19, but it is going to come to us on a gradual pace. So in all sectors, we need to have joint efforts. And we need to have a new surveillance system or new food control programs and projects in order to overcome this issue. So this is a graph that shows where we will see a lot of death due to AMR. This is just an estimation, but you can see that Asia and Africa will have high mortality rates. Now, for the statements for One Health approach, we also work a lot with policies in our research institute. So I brought some important parts of the statements that are out there. And these are all related to agriculture because that is what I'm focusing on in our field. The G7 in 2022 welcomed the guidelines on integrated monitoring and surveillance of foodborne antimicrobial resistance. And also, in 2023, the G7 agricultural ministers gathered and announced that they support the aims of the One Health Joint Plan of Action. We have a lot of research plans, and we selected the research plan that includes the health of humans, animals, plants, and the environment as number 3 of the One Health mission. WHO and World Bank also released a report called Sustaining Action Against Antimicrobial Resistance in 2022. They're inducing a lot of people to actively participate in our efforts against AMR. And tomorrow, we were going to have the second high-level meeting at the UN General Assembly and on AMR. The title is Disruptive Innovation in AMR, a Collaborative Approach to Change. So we do acknowledge that this is an issue, but what we need to do is we need to gather energy and resources from many different sectors to resolve this issue. And that is going to be the topic that will be discussed tomorrow. So another limitation or challenge that we need to overcome is the funding commitment over the long term. And this is a report that came out in 2022, and then I will move on to some of the research details that we are conducting. So for this, we had an isolation of about 15 million samples, and it added their estimation model to analyze what is happening in the world, to see the AMR pattern that is going on in the world. If you look at the slide on the left, you can see the resistance for carbapenem. And the orange color means that already 50 to 60% of the isolates were resistant to carbapenem. And on the right, this is resistance to cephalosporin. And we didn't do anything, but already the current status showed that 70% of isolates were resistant to cephalosporin. And among the top 10 antimicrobial resistance pathogens, in 2019, we had 1.27 million global deaths, which was directly by bacterial AMR. And also, it contributed to 4.95 million deaths. Also, all 6 of the leading pathogens contributing to the burden of AMR in 2019, E. coli, S. aureus, and so on, has been identified as priority pathogens by WHO. And now I would like to show you the research trends in fresh produce and with antibiotic-resistant bacteria. So what we do is we isolate the microorganisms from the fresh produce, and then we have the sequencing and Mallet process. And this is not just from the fresh produce itself, but we also collect samples from the soil and the water that is used to grow this. And we collect the microorganisms, and then we analyze what kind of microorganisms these are and what kind of resistance that it has, what kind of antibiotic resistance that has, and if this is also transmitted to the rest of the agricultural environment, or also if it is transmitted to the food products. So I'm also participating in this kind of research, and this is a research that was done by CDC in 2019. So in 2019, CDC, they already had this kind of picture that bacteria are everywhere. So not just about the antibiotic treatments that are being done in hospitals, but the antibiotic resistant bacteria are all over the place, included in the waters, the soils, the environments that we live in. And also looking at the agricultural front, we have a lot of the AMR that is coming from animals, and also a lot of AMR that is coming from the remnants or animal waste. A lot of the fresh produce is being consumed without being heated. So this can lead to infections or transmissions of AMR. So we focused our research on the agricultural environment, and it was based on the estimate that we would have a lot of antibiotic-resistant bacteria being transmitted in the process. So the samples were vegetables, fruits, salads, fertilizer, and water and soil. And then we had the culture-dependent method. So for these, you have to do the culturing process in order to learn if it's antibiotic resistant bacteria. And then we also use the culture-independent method. We extracted the DNA and RNA and used the metagenomic methods in order to see what kind of microorganisms were existing in the samples that we collected. And also we looked at the potentials or the possibilities of transmissions. And I focused on the conjugation test within the plasmid. If you have a resistance gene, then this can be transmitted to other areas. So we focused on the transmission. So now I would like to introduce the results that I have received. So this is not just from the agricultural market, but agricultural field, but also from the market. So here, if you look at, you can see the total number of bacteria that we have had. So we had more numbers of bacteria isolated than I have expected. We have E. coli, and which is also included in the number of Enterobacteriaceae. However, fortunately, the incidence of foodborne pathogens, such as salmonella, were not in the fresh produce was very low. And also the antimicrobial or resistant organisms were not very high or isolated in our samples. So we were wondering if it's the same case in Korea. So we worked together with the Rural Development Administration to conduct this kind of process in Korea. So our target sample was lettuce, because Korean people love lettuce. We have lettuce in a lot of our foods. So we focused on the lettuce samples, the ones that are manual treated or not. So we had about 400 strains isolated, and we are carrying out further studies on this. And the fortunate result is that only 8 strains were resistant to meropenem. So it showed you that overall in the world, 15% of these strains were resistant, but in Korea we only saw 8 strains that were resistant to meropenem. So we did not have the whole sequencing yet at this level, so we just looked at the family level. So 30% of the isolates were identified as pseudomonas. So with this, we are carrying out further studies, and I would like to show you some interesting results. So we found some novel species from the lettuce and lettuce agricultural environment. So this is included in the Scandinavium genus, and we called it Scandinavium lactucae. It was isolated from healthy lettuce in South Korea, and Scandinavium is actually multi-drug resistant. However, the Scandinavium lactucae was not highly resistant, but it also had a similarity to QNRB96 with 95% of similarity. And we also found another novel species, and we named it Liliolatu wonjuensis, and it was found in the lettuce from Wonju in South Korea. So this was very close to the type of strain that was already found in traditional Korean fermented clams. So you can see that the microorganisms that were in food could also be existing in the agricultural environment, so this can be transmitted. So now coming back to the study in Germany, with the isolates that we have obtained, we carried out further study. We selected 24, and because they did not have AMR features, because we did not have much antimicrobial resistance, what we did was we looked into the genetic features of these sequences. So we had the Crepsinolia, which was ESBL positive. The Crepsinolia has the structure genes for conjugation and also is ESBL phenotype. Also, E. coli, more interestingly, so E. coli is something that we know very well. It is a it also has the drug resistance genes. And related to conjugation, it has the conjugation structure. And the smallest had the mobile genetic genes. So with this, we did a conjugation test. And if you look at this, the plasmid, we wanted to see if it could be transmitted to other microorganisms. So we made this kind of test setting. So we used the sprouts, and we made a set. And then, so at first we just used the leaves. In the second test, we made the vegetable agar, and then we used the transfusion. So we wanted to have this a very nutrient-rich agar. And we did the conjugation test. The reason that we selected E. coli is because we have a lot of recipient pathogens for E. coli. Our estimates, according to our estimates, we wanted to look at how the genes were transmitted. And if you see here, you can see that there are conjugation numbers. We had about 120 conjugations, and we had a complete sequencing, and we wanted to see what kind of plasmids were transmitted. So during the conjugation, what was interesting was we found an unexpected transconjugator. So sometimes we would have doublings, sometimes we would have smaller sizes, and sometimes we saw that smaller plasmids were created. So in the agricultural environment, especially in microorganisms in fresh produce, microorganisms could be transmitted. Then, in reality, what plasmid is existing in fresh produce? That was my question. So what we did was we made a test plate where we used sprouts. And then we used the recipient vegetables that we have used before, and then we used the plasmids that are already existing in the sprout. We found about 50 plasmids, and I want to introduce 2 of them. One was about 70,000 base pair, and this has all of the features of the conjugation, and it has a multi-drug resistance. And it also has the genes, tetracycline resistance genes, as well as the additional quinoline, sulforamide, and trimethoprim resistance genes. And it also has a gene that is resistant to various metals. So, in essence, actually within the sprout there is plasmids, and the plasmids have metal-resistant genes. Then, who can be the host of these plasmids, or who could be the recipient of these plasmids? So we analyzed the metagenome. So we used the exogenous plasmid test. So we looked at what kind of hosts could be the candidates, and we found more than 50% of these called Enterochyta. And the Enterobacter cloacae, this was included as a carrier in our sample. So in the plant, we have antimicrobial resistant organisms, and this plasmid could be transmitted. That was our conclusion. So back to the Korean study, we conducted a further study on the Korean test. So we did the isolates. We used the isolates for 160 sequencing. And unfortunately, we did not find any ESBL. So in the Korean agricultural environment, especially in the agricultural environment that grows lettuce, there is no ESBL, and we had basically low antimicrobial resistance. And also sequence 11, 147, and 258, and 307, the high-risk sequence types were not detected. Then, the Klebsiella that is found in our hospitals and in the agricultural environment, how different they are was what we wondered about. So we compared the genomics of Klebsiella pneumoniae. So we wanted to look at the antimicrobial resistance features of these two. So the Klebsiella pneumoniae isolated from hospital had very high resistance compared to the ones that were found in the agricultural environment. So you can see that these spots are concentrated on this field. So we compared the genes, and the other features of the genes were not very different, but the antimicrobial resistance feature was very different from these two. And to show you a picture of this, you can see on the right, this is the one that was isolated from the hospital, and on the left, this was isolated from the agricultural environment. So all hospital isolates possessed multi-antimicrobial resistance genes, but the isolates from lettuce and lettuce agricultural environments were not highly resistant, multi-drug resistant. So the conclusion is that everyone is at risk. We all consume vegetables and fresh produce. So because the plasmids could be transmitted from what is in the vegetables, We need to control all factors in all aspects. We need to have adequate use, appropriate use of antimicrobials in the agricultural environment. We need to use an adequate dosage and also lower the use of antimicrobials. This is the end of my presentation. Thank you.
Thank you very much for very interesting talk. Okay, so we are going to move on the third speaker. Next speaker is Dr. Suk Kyung Lim. Probably many people know her. She is working at the Animal and Plant Quarantine Agency. She has spent over 20 years at and work with antimicrobial resistance in animal and plant quarantine agency. Actually, he did play a crucial role to launch Korean veterinary antimicrobial resistance monitoring system. She is the leader to draw that program since 2008, almost 16 years. Okay, she shares her data in animal sector about to reduce AMR strategy. Okay.
Thank you for kind introduction, Professor Yoon. 저도 한국말로.
I will also speak in Korean. My presentation title is AMR Situation and Containment in Food Animals. And this is the content of my presentation, current situation of AMU and AMR in livestock, and how it's affecting humans, and some of the research results from my lab, and what kind of strategies we are taking to tackle AMR in the livestock industry. Before moving on to my actual topic, but I want to talk about the current situation in Korea. And the first picture is also was shown during the Daniela's presentation, but in the livestock industry, there are antimicrobials just for animals, but animals share antimicrobials with humans. When we abuse or misuse antimicrobials, it leads to antimicrobial resistance. And antimicrobial resistant bacteria can be transmitted through various channels. However, it's very difficult to manage all animal-specific antimicrobials, and that is why WHO and WAH have come up with a list of medically important antimicrobials. And you can see that HPCIA includes many antimicrobials, and you can see them on the slide. And WHO says that this critically important antibiotics for humans should be used with caution. It's the same from OWA. OWA advises against using antibiotics for prevention and recommends use only after efficacy testing. And when treating diseases, antimicrobials should not be used as the priority line, but rather used after efficacy testing. So the Korean government has come up with the first and second national action plans. And the first national action plan is from 2016 to 2020. Second is from 2021 to 2021, which is still ongoing. There are about 5 to 6 strategies under each plan, and both plans include strengthening surveillance system as well as advanced R&D for AMR, such as scientific-based AMR surveillance and others. In Korea, AMR surveillance system is managed by different ministries. Livestock by MAFRA, Ministry of Food, Rural and Administration. Retail, Food and Livestock by MFDS. And all of the results are shared via especially on AMR and AMU, are shared via the One Health Portal system. Next is about Korea Veterinary Antimicrobial Resistance Monitoring System. We call it KVOM. And KVOM was launched in 2018. This includes AMU and AMR data, regional and city-level laboratories, deal with production-level livestock. MFDS deals with livestock in retail. And all of these survey results are collected and published into annual reports, and these reports are published on official websites. Next is about our methodology. AMU data is basically sales data. So we collect data from manufacturers, and they report their result through the Korea Animal Health Products and Association system, and the results are submitted to our agency for review and analysis, and then sent to the OWA Global AMU data. AMR monitoring focuses on cattle, pigs, chickens, and dogs. Our target bacteria is indicator bacteria as well as foodborne pathogens. Let me tell you about the results of our research and survey. I think there are two main key policies for managing AMU in livestock. One, gradual ban on adding antimicrobial in compound feed since the mid-1990s. Antimicrobials cannot be added into feed starting from mid-1990s. And starting from 2013, veterinary prescriptions are required. And we have extended to include all antimicrobials by 2020. So with the introduction of the first policy, we were able to see a reduction of antimicrobial use by 30%. After adopting the second one, we were able to see about 720 to 730 tons of AMU. The bottom graph shows the AMU by species, and the red bar shows AMU for pigs, and you can see that pigs account for more than half, 50% of total sales, followed by chickens and cattle, with cattle making up less than 10%. Let's take a look at antimicrobials by sales. Tetracyclines and sulfonamide, which were common in compound feed, have decreased over time. However, penicillin and phenycols have increased in its usage, as you can see from the graphs, and WHO HPCIA, which are third and fourth generation cephalosporin, have risen. However, quinolone use has decreased, likely due to the 2021 ban on fluoroquinolone sales for poultry. So in 2021, quinolone sales have decreased. When comparing our data to global data, you can see antimicrobial sales patterns in Korea, and we used OWA's Animus report, and global ranking shows tetracyclines and penicillin as most common, whereas in Korea, penicillin and phenycols and macrolides lead. And if you see the percentage of global data and Korean data, we tend to use third and fourth gen cephalosporin more than other countries. And we tend to use quinoline, polycinin more than other countries. Then let's compare our AMU and AMR by species. The bar graph shows sales, and the line graph is resistance. So for orange line, it refers to antimicrobial susceptible strains, and the green line shows multi-drug resistant strains. So for cattle, over half of the tested strains were fully susceptible and have a lower rate of multi-drug resistant. But for pigs and chickens, they have high sales and they were very susceptible. We also did analysis by antimicrobials. AMR trends show that cattle with lower sales maintain low resistance, while pigs and chickens have higher resistance. And we can see that sales really reflect the resistance rate. While tetracycline and trimethoprim have been decreasing, but ampicillin and chloramphenicol have shown higher resistance because they have higher sales in Korea. One of the most crucial antimicrobial is multi-drug resistant antimicrobial. And CIP resistant in chickens has decreased but remained high over 60%. And we believe that antimicrobial sales really reflect the percentage of resistance, but we wanted to see the prevalence of resistome of healthy pigs and cattle. So from 25 farms, we were able to survey some of the antimicrobials, and pigs and chickens have shown higher resistance across almost all antimicrobials, but that was not the case for cattle. The orange bar shows cattle and the blue bar shows pig, and you can see that pigs have shown higher resistance across all resistant genes, and for aminoglycosides and beta-lactam antimicrobials, it was the same result. Then comparing Korea's AMR levels with the other countries, we took their monitoring data and compared to ours. For Campylobacter resistance, they were quite resistant to macrolides, but in Korea that was quite relatively low. However, third-gen cephalosporin and fluoroquinolone resistance were quite higher compared to other countries. So far, we talked about indicator bacteria, but foodborne pathogens can be transmitted to humans. So we look into these pathogens. So we compared AMR in livestock and humans, and we analyzed resistant trends in foodborne pathogens like Salmonella and Campylobacter. For third-gen cephalosporin, Salmonella showed higher resistance among humans, but for quinolone, it was higher among livestock. However, resistance trends you can see from the graphs are quite similar between livestock and humans. Therefore, it is suspicious that bacteria can be transmitted from animals to humans, but this requires molecular genetic analysis. Next, I would like to talk about some of the bacteria that can have huge impacts on human health when transmitted from animal to humans, mainly ESBL-producing Enterobacteriaceae and MCR-carrying Enterobacteriaceae. According to CDC data, ESBL-producing Enterobacteriaceae cause around 9,000 deaths annually. And we conducted a survey nationwide on 60 farms, and 10% of the livestock across the nation are resistant to third-gen cephalosporin. And for CTS type, we had 4, and we were able to identify CTS M55 was the most predominant. When comparing to our previous study, we were able to identify shifts in CTSM genotypes for chickens and pigs. 55 type is increasing for chickens, and 14 and 55 for pigs are increasing. I believe this is the overall trend in Asia, where CTS M55 is on the rise. This is because I2 plasmid can be transmitted to other host sources. So mobile elements such as IS-ECP1 and IS-26 are in motion. So we can see that CTS M55 is one of the predominant types in the livestock, and this is research from Yonsei University, and they took data from pigs, the farm environment, and the human, and they isolated. And after WGS, WGS analysis showed that different sequence types for pigs, environment, and humans. So different sequence types, but same E. coli. In our lab, about 10 years ago, we were able to identify that 14 and 15 are predominant SG types. So among humans, SG131 and SG405 were predominant, but they were not identified or detected among animals. And SG542 and SG93, which are predominant in animals, were not detected in humans. So this shows that for E. coli, there is no direct transmission between livestock and humans. There is low correlation in Korea. Similar findings were actually found or reported by a Dutch team. ESBL E. coli is reported to be transmitted between humans rather than from humans. So this result findings also showed low attribution between animals and humans. So specifically ESBL producing E. coli, there is no or lack of correlation between humans and animals. That's our findings. But that is a different case from Salmonella. Since 2010, we have been screening Salmonella, and specific serotypes have shown third-gen cephalospore-resistant Salmonella. Especially these were found among chickens, about 20% resistant, and they have a CTS 15 or 5 types. To see if there is any horizontal transfer, both serotypes for enterotitis HI2 and for virtual HI2 were detected both in humans and livestock. To see clonal spread, we took PFG patterns for both humans and livestock, and both serotypes showed identical patterns. So unlike E. coli, Salmonella may have a higher potential for transmission to humans from animals. When we are very focused on enterotitis and virchow, Salmonella infantis is reported to be prevalent across the nation. This infantis has megaplasmid, which has resistant genes. This is becoming more critical across Asia, Pacific, America, and Europe regions. And sources are mainly humans, but also from animals, mainly poultry. Since 2010s, we have been also looking into infantis. Since 2020, we are seeing an increase in the prevalence of Salmon infantis, mainly from poultry and chickens. And we looked into the plasmid after WGS and CTS65 and aminoglycosides, as well as tetracyclines, as well as sulfonides. Resistant megaplasmids were also detected in Korea. So MDR Salmonella infantis should require our attention moving forward. Next, I would like to move forward with the mobile colistin resistance MCR. In China, the MCR carrying E. coli was first reported in 2015, and it was also the case where US, UK, Japan, and South Korea detected MCR carrying E. coli in humans. About 15% of the MCR carrying strains are detected in chickens. And by region, we see these strains among African and Asian regions. In 2020, 9 variants were identified. Now it seems to be 10 variants. And about MCR1 is mostly reported in Asian regions. In 2015, it was the first time when MCR carrying E. coli was reported among pigs and chickens. And we identified and detected E. coli, MCR carrying E. coli in fresh produce as well. We have 2 types, MCR1 being the predominant one, and rarely we also see MCR3. So about 1 out of 3 human isolates were clustered in the same clade with livestock, whereas the other 2 belong to other clades. When comparing MCR1 carrying I2 plasmid backbone isolated from humans and livestock, we were able to see that plasmid from one strain isolated from humans was quite similar to those from livestock. Currently, we are seeing an increase in AMU, and this leads to higher AMR in the livestock. That is why the Korean government has banned the use of fluoroquinolone among poultry, as well as sales of 3rd-gen cephalosporin. For prudent use of antimicrobials, we have created and distributed guidelines for antimicrobial prescription for pigs, cattle, and chickens. And for critically important antimicrobials, they need to be used as a last resort. As mentioned earlier, raising awareness is critical. That is why we are carrying out online and offline promotional materials. From the perspective of One Health, our approach is very critical. As mentioned, we have developed and implemented 1st and 2nd National Action Plan for both humans and non-humans. And we are collecting and sharing AMR and AMU data between humans and livestock. For research from 2019 to 2023, we have surveillance, transmission, diagnosis, control, and other research areas. I will skip the summary part. That is the end of my presentation.
Okay, thank you, Dr. Lim, for sharing the extensive data in Korea. Okay, now we bring up the 3 speakers, all 3 speakers, to take a question from the floor. I think this session's first speaker shared the idea about the feed additive. You know, we have to instead of using the antibiotics in feed or feed additive, and we can develop kind of the practice or management with the using the antibiotic alternatives such as phytochemicals. And second speaker, the Dr. Jo, shares his data showing that the freshly produced isolated bacteria can spread the MDR genetic element with the other bacterial strains. It may be very important. We have to establish the One Health approach to control the AMR issues. And last speaker, Dr. Lim, she actually shared a lot of data in Korea. So a lot of things going on to combat AMR in Korea, especially livestock animals, 3 major animals. She shared the AMR resistance profile and also what the Korean government to have done so far. Okay, now we are going to open the question from the floor. So if you have any question, raise your hand. Okay.
Well, thank you very much for the 3 presentations. Top quality, very technical this time. Well, with Danielle, I can speak every day in Rome, so I will not make her a question. But I do have a question to Dr. Gu and Dr. Lim. Starting with Dr. Lim, the final data that you presented is not very good or very optimistic, but that's why we are here, because there is this big issue of foodborne AMR. I have a question regarding phenycols use. You said it's surprising that it's second-class use. It's quite consistent across the world that it's always tetracyclines and penicillins, the classes most highly used, and here it was phenycols. Especially chlorphenicol and fluorophenical are very known to have consequences for human health. So I was wondering if you know what they are used for and why they are still used. Many countries are banned them, especially thinking about the human health. So this use of phenycols in Korea, if you have any idea what it is used for and if there's any progress on stopping using them.
저는 한국말로 그 답변을 드리도록 하겠습니다.
I will answer in Korean. For chloramphenicol, they belong to phenycal class. We have chloramphenicol and fluoromphenicol. National Surveillance Monitoring System checks chloramphenicol among the class, and chloramphenicol use is banned in the livestock in Korea. But I know that fluoromphenicol is mainly used for respiratory diseases for pigs. And we believe fluoromphenicol use has increased resistance for chloramphenicol in the livestock of Korea.
Thank you. And so I guess that does maybe we have some policy work to do regarding that use. Because as you said, one leads to the resistance to the other, and there might be some policy work to do there. Then the question to Dr. Gu, also very, very interesting data that you presented. And it was very technical. But so I would really like to understand if I got the message right. What you found in fresh produce, you found a lot of plasmids that carry antimicrobial resistance gene. So you didn't find much resistance, but you found a lot of plasmids. When you say that you are all at risk, is that these plasmids can be transferred to other bacteria that we have in our guts. And so that's the risk that you mentioned. From the fresh produce, you can get plasmids that can later get into our own microbiome. Was that the main message of your talk?
First of all, thank you for your question. Actually, we would like to find out how do they transfer the antimicrobial resistance to the human. But this is, you have to keep in your mind, I'm as a microbiologist, we are actually doing our research in certain area, the experimental setting. In those cases, we can figure out some plasmid that can transfer in this system. But we don't know exactly how does it happen when we consume this fresh produce. We didn't know that. We couldn't tracking those plasmids from our, from fresh produce to the food chain and storage, market. But in certain case, maybe it's important, can transfer those kind of plasmids isolated from fresh produce to human. Then maybe it will be a real problem because, as you know, the fresh produce, nobody actually, heating. We just consumes as fresh as possible. Therefore, my message is, in certain, in experimental setting, we can find out some plasmid can transfer in our setting.
Okay.
Thank you very much for very informative presentations. I have 3 questions, one per each presenter. My first question goes to my best colleague, Daniela Batania. Thank you for your presentation in introducing FAO's activities, developing informations and science, and support capacity buildings. But I want to know what is FAO policy on AGP. Another question, you have shown us many countries have banned AGP in their regulations, but you told us in principle, in implementation is different story. So what is the difference? And I know many farmers still mix feed and antimicrobials after buying separately. So yeah, I want to know your opinion. First, Daniela.
Thank you, Myung-Shin. And I will start from the second question, which is easier to understand, less challenging. Yes, indeed, we know it has been shown that even though in many countries by legislation, antimicrobials cannot be used as growth promoters, still farmers are using them, they're still having access, so they're still mixed when they do on-farm mixing with the feed at farm level, or they can find in medicated feed. So, but that's not only for antimicrobials. I mean, in many aspects, there is one thing is the legislation, one thing is the application and the enforcement. Therefore, there is a lot of work that still has to be done to work with farmers, to work with private sectors, to show what are the risks, to provide them with enough information on how they can do so. I mean, in the end of the day, it's always an economical problem. They think they're scared that the production or the productivities will decrease. So we have to show them what they can do to improve their overall management and to avoid the use of antimicrobials without prejudice to the economic sustainability of the sector, so without lowering their productivities. Then can be done, but again, it's a matter of awareness, it's a matter of having access to information, and it's a matter of having access also to those alternatives that could allow the avoidance of antimicrobials. And again, many of them could be expensive for certain farmers. That's why we need to still develop new alternatives which are cheaper, locally available, and easier for the farmers to have and to use. Again, it's not only for antimicrobials. That's food safety. One thing is the legislation, one thing is the application and the enforcement. The first part of the question is a little bit more challenging because FAO is an intergovernmental organization that has to provide information for the countries that in a totally independent way can deliberate. So we are providing advice to countries and we're providing enough information to show that the use of antimicrobial growth promoters is not favorable because of the development of antimicrobial resistance. Still, those countries have to decide what is the policy they want to have in their countries. But what we want to make sure that there is enough information available for countries to decide to ban the use of antimicrobials without any prejudice to their production. And again, the first, the lowest hanging fruit is the one which is more important is the avoidance of the use of medically important antimicrobials. So that's the first use we have to address. But again, it's important for everybody to know what can be done to decrease the use of antimicrobials. The information needs to be there, and the support to the development of specific policies, the specific legislation is also there by FAO, especially linking to other countries that have already done it, and again, without prejudice to the food security, so the production of enough food at an economically sustainable way.
Thank you. My second question goes to Jo Kyu-sung in Korean. Jo Kyu-sung 박사님 발표
Thank you, Professor Cho. So you are working overseas right now, so you know overseas situation and Korean situation. I think you're in a very favorable position in that. So working overseas, is there something you want to give advice to Korea or propose to Korea? Okay, so since it's a Korean question, I will answer in Korean as well. So I am just working with microbiology, so I don't know that much, but just to share my opinion, I believe that Korea is already a very well-developed country. So I keep mixing Korean and English. I apologize about that. So you showed us a lot of information. And in the presentation, we have a lot of data in Korea. A lot of data is being collected, and we have a lot of talented professionals on field. And in Korea, if we consider the economic power, we can be the leader group of the world. And because based on these thoughts, so I think it would be good if we could do something that people didn't do yet, or do things that require a lot of resources. I think Korea can lead some things that other people are not doing, and that's just my personal opinion. Thank you very much. Thank you.
To Lim Suk-kyung in Korean. 조규성 박사님이 말씀.
As mentioned by Dr. Cho, Korea is already developed nation, and it has the ability to support other nations. We have grown and developed to that point. How do you think about that, and do you have any plans going forward? Personally, I believe Ministry of Food and Drug Safety has already led the second CODIS ad hoc committee and has projects with FAO. So Korea is already serving that role. But personally, since I work at the Ministry of Food and Agriculture, and we want to reduce antimicrobial resistance through various initiatives and activities from our ministry.
Full question? Okay.
Yes, I do have a question for Dr. Lim. In one of your slides, you presented data on Salmonella enteritidis having high levels of resistance to to quinolones. And I just wanted to know, have you identified what that mechanism is?
Yes. 한국말로 하겠습니다.
For quinolone-resistant Salmonella enteritidis, we identified mechanism, and this seems to be stemming from mutation, and plasmid quinolone was also identified. But the main mechanism is QNDR's mutation.
I just wanted to comment that we are also observing that in the U.S., an increase of that in the U.S., and so I was curious to see what the mechanism was that you found in Korea. And then also, I had one more question about, also to you and to Dr. Cho, about when you're looking at the plasmids, are you also looking at other types of genes, like heavy metal resistance genes, biocide resistance genes, that potentially could be propagating that plasmid?
For conjugated plasmids, we identify what kind of resistance each gene has. Of course, there are genes that are resistant to other. For MDRS infantis, we will also identify heavy metal resistant genes.
Germany, we do the whole genome sequencing based sequence release to complete genome data from those strains. It's actually our plan. So my plan is my scientific plan is we want to make a map how to look like based on the plasmid, from the fresh produce like a cucumber and and salad, lettuce salad. What kind of plasmids are existing in those samples? Then we can maybe measure the transferring, the antimicrobial resistance in those settings. I mean, not directly to the human, but we want to know that. Therefore, we can actually tackle antimicrobial resistant transferring in those systems, not directly to consuming, but before the consuming, wash and collecting, harvests, and storage as well. Therefore, we want to make some, therefore we do everything. We just complete sequence and generated not only the AMR and metal-resistant, incompatibility, mobile genetic element, even hypothetical protein. We can make a BLASTA P based on this, this hypothetical protein, find out what kind of genes are existing, even if we're not already, published or already make a public data.
Okay, so one last question. Okay.
네, 감사합니다.
Thank you. So in Korea, I think we have a lot of food poisoning from salmonella, which is a serious problem. So from the Ministry of Agriculture, for salmonella, and it is managed in terms of disease, and salmonella in and in the 3 types of salmonella are being managed for the food. So I think you are working with Infantis, and I think Infantis management is really important. So in order for the government to manage this well, in terms of policy, is there some improvements that you are planning, or any recommendations or advice on that?
This is a difficult question for me to answer. I'm at the R&D division, and personally, we see that Salmonella infantis is on the rise, which leads us to communicate with other ministries for cooperation. But for humans' perspective, Salmonella enteritidis becomes more problematic. Since we focus on production stage, we share data that is relevant to production of livestock, and there is another division that is also aware of other steps, and we also recognize the importance of having such policies.
So, it's okay? Okay, so our time is the finished. So I think all 3 speakers made a wonderful talk, and also it was a very productive discussion. So I'm very appreciate all of you. And please give your big hands for all 3 presentations. Okay, so now I'm gonna wrap up, and maybe we have another day for the discussing the AMR tomorrow. So okay. Thank you very much.
Thank you, Professor Chang Won-yoon, for your wonderful moderation, and also thank you to our 3 presenters. Please give them a big hand. And with this, we conclude the first day of the 4th MFDS Global Conference on Foodborne Antimicrobial Resistance. We had in-depth presentations and meaningful discussions. Today's conference, thank you for congratulating the opening of our conference and also participating in our conference, both in person and online. I would like to thank all the participants. So this conference, we will be continued at 10 a.m. tomorrow morning in Korean time with session 3 and session 4. We ask for your continued interest. Thank you very much.